IT&D.
Self-storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc. Be healthy. Be informed with IT&D.
In order to win this war against COVID-19, it's going to take all of us to do our part.
We are all frontliners in this epic battle.
And on Tuesday, May 5th, we're asking you to answer the call to help by taking part in Giving Tuesday Now.
It's part of a global initiative to set aside this one day for the pandemic crisis.
To step up and give a donation to any of our island's nonprofit organizations,
the hospital, the Mayor's Council of Guam, or any of our frontline workers. Whether it's PPEs, gloves, masks, canned goods, no donation is too small. Anything and everything will help.
And if you make your donation, take a picture, post it on social media, and use the hashtag GivingTuesdayNow and Giving Tuesday Guam.
And then later that night, make sure to tune in for our half-hour special Giving Tuesday Guam, Together We Give. We'll showcase how everyone is taking part.
Be healthy. Be informed with IT&D.
not coming back. I told the mailman he can skip my door, 'cause I don't want to read your mail no more. No. Return it back to sender. Yeah. Return to sender. If you don't want it anymore, your hidden agenda. It only works if I don't know, so you're better off left alone. Don't write me no letters, I'ma send them back. Scratch the numbers off the package so it can't be tracked. You can bet all your money and lick your stamps. They might fire that post and we hire him back. Don't write me no letters, I'ma send them back. Scratch the numbers off the package so it can't be tracked. You can bet all your money and lick your stamps. They might fire that post and we hire him back. Return to sender. Send your body from space, 'cause I don't want it anymore. Your hidden agenda only works if I don't know. Oh yeah. Return to sender, 'cause I don't live there anymore. I think it's better. It's better if I am here no more. If you'd rather be left alone.
Good morning, Guam. All right, 6:14. It is the 30th day of April, the year 2020, and the show, it's KUAM News' takeover of Guam's favorite, I-94. We're KUAM FM in Agana, Guam. Good morning on you. Thursday. And the show, of course, all the way live right here on the radio, and we're streaming at KUAM.com and on the KUAM News app. Also, Docomo stream on Docomo Channel 10. That's an audio thingy. And we're jumping on KUAM TV 11 at 8 a.m. to 10 a.m. It's the last half of the show. And last but definitely not least, good morning, Guam, CNMI, and beyond from Bardstown, Kentucky to Italy this morning. Our KUAM News Facebook Live viewers.
San Diego and Las Vegas.
There you go. So good morning on you guys, and thanks for watching the show and real information, real time as usual. We got a big one for you guys today. You never know what's going to get uncovered in the next 3 hours and 45 minutes. Stay tuned. All right, and as we always do, we start the show with a deep dive into the day's COVID-19 news from the KUAM News team. Good morning, Sabrina Salas-Mantanani.
Hafaday and good morning, everyone. The latest from the Joint Information Center released at 11:35 p.m. last night. Public Health tested 112 individuals for COVID-19 on Wednesday. 0 tested positive. The results include samples from the COVID-19 expanded testing in Estumbo, Dededo. To date, there are 145 confirmed cases of COVID-19 on Guam. Again, there are 5 deaths and 130 released from isolation. The U.S. Navy began the process to return groups of sailors from off-base hotels to the aircraft carrier USS Theodore Roosevelt, which is on board Naval Base Guam. These sailors were previously in a restriction of movement in Guam hotels as a result of COVID-19 infections on the ship, and they have since been cleared to depart quarantine and return to it. Approximately 700 sailors remained aboard the Roosevelt to maintain the ship's essential functions and to conduct deep cleaning and sanitization of the ship's spaces over the past few weeks. Now the ship is fully prepared to receive healthy sailors who have spent up to 27 days in quarantine ashore. These sailors have had 3 negative COVID-19 test results, including 1 to determine eligibility to depart Naval Base Guam for hotel quarantine, and 2 additional tests to ensure they are COVID-free and healthy. Governor Lulian Guerrero, in the meantime, and Lieutenant Governor Josh Tenorio toured the Department of Defense's Expeditionary Medical Facility, or EMF, which is under construction in South Finnegodson, along with DoD leadership. Joint Region Marianas Commander Rear Admiral John Manoni hosted the tour, which included guests of Major General Esther Agagi from the National Guard, Brigadier General Tracy Smith, he is the commanding general of the 18th Medical Command Deployment Support. The Navy Seabees continue construction on the 150-bed field hospital, which will provide expanded medical capabilities in support of DoD's COVID-19 response. The EMF project is expected to be completed in the coming weeks. Grab-and-go school meals at FB Leon Guerrero Middle School will be suspended until further notice after one school meals worker tested positive for COVID-19. On Wednesday, GDOE learned that a grab-and-go school meals program worker at FB Leon Guerrero Middle School tested positive for COVID-19. The worker had been tested as part of contact tracing on Tuesday and was informed of the results on Wednesday. Prior to being tested, the individual had been working at the school distribution site. Immediately after learning the worker's health status, Superintendent John Fernandez suspended operations to allow for deep cleaning of the campus over the next several days. All FBLG Middle School grab-and-go school meals workers and volunteers will also be tested for COVID-19 by Public Health. In other news, Speaker Tina Munoz-Barnes is demanding transparency in a letter to Public Auditor B.J. Cruz. She's asking for his help to ensure federal programs that are being administered by the administration are being done with the utmost transparency, effectiveness, and efficiency. The Speaker writing, quote, "Trust but verify. While we hope the administration would be transparent with this separate and co-equal branch of government, we will do our part to ensure we get the facts." Her request follows the governor's veto of Bill 333, which would have ensured transparency and accountability with how federal money is being spent on COVID. With the recent veto, the Speaker says the legislature will now use various mechanisms in place to ensure that our money be accounted for. The Speaker, in her letter to Public Auditor B.J. Cruz, wrote that, quote, "We've been waiting for weeks for programs of a massive scale to be implemented. While we wait for them to be approved, it is prudent that this time is used to ensure that once these programs are approved, we can immediately get funds into the hands of our residents. Our people have no more time to wait." Senator Joe S. San Augustine wants some answers from the Department of Administration and has sent a letter to Director Edward Byrne wanting an explanation for their non-compliance with personnel rules and regulations relative to double pay for essential employees during an emergency. According to DOA rules and regs, Those employees required to remain on duty to provide essential services shall be paid at double the regular rate or granted compensatory leave credits for the hours worked during the period the facility is closed and the other employees are on excused leave. It was on March 14th, Governor Lulian Guerrero signed an executive order that declared Guam in a state of emergency. According to the senator, this order should have executed the provision for the double pay of essential employees as determined by the agency head. These employees were required to report to work while others not required were placed on administrative leave with pay status. Quote, to date, our hardworking essential employees have not been compensated in accordance with these rules. We need to fix this. The Guam Memorial Hospital will be applying for a CARES Act Paycheck Protection Program loan from the federal government. According to Senator Amanda Shelton, she received the word on Wednesday. The lawmaker had recommended GMH to do this after learning about the funding availability. The senator adding the decision comes after hospital administrators, together with appointees of the governor, determined that GMH meets the eligibility requirements for participation in the PPP after a U.S. SBA rule change enacted over the weekend. I don't know if you know this, Chris, but the Committee on Rules is actually meeting today.
What? I didn't know that.
Yeah, they're
I
meeting
think
today.
I'm just I'm freaking out because the senators are writing letters and it looks like they're turning on the administration.
Yeah. All right, let's move on. U.S. Attorney Sean Anderson had forwarded information to the Department of Justice's Civil Rights Division after obtaining letters written by the Archdiocese of Guam and Public Health Director Linda DeNorsi. As plans began to unfold for the reopening of the island, the Archdiocese of Agana sent a memo on April 22nd to Governor Lulian Guerrero and DeNorsi with recommendations to reconvene spiritual practices. The letter asked DeNorsi and the governor to allow the church to conduct outdoor masses among other requests. DeNorsi denied the request for outdoor masses. Chair of the Liturgical Commission, Father Paul Gofagan, in the letter said that recommendations could be implemented while exercising current precautionary measures like social distancing and wearing PPEs. Meanwhile, U.S. Attorney spokesperson Carmela Rapadas tells KUAM that the U.S. Attorney Sean Anderson has obtained the letter from the church and Public Health's response and will be forwarding both to the Department of Justice Civil Rights Division. The letter from the church also asked for Public Health to allow giving of holy sacraments, offerings, baptisms, confessions, and pastoral visits to the homebound sick. According to the DOJ's website, the Civil Rights Division, quote, works to uphold the civil and constitutional rights of all Americans. The division enforces federal statutes prohibiting discrimination on the basis of race, color, sex, disability, religion, familial status, and national origin. Meanwhile, the Archdiocese of Agana, Archbishop Michael Burns, will reconsecrate our island to the Blessed Virgin Mary this Saturday, in line with the Catholic Church's efforts in the United States and Canada. The reconsecration will take place during 5 a.m. Mass on Saturday, which will be broadcast from the cathedral on KUAM Channel 8, as well as live stream on our Facebook page. Following the Mass, the historic statue of Santa Maria in Camelon will travel through island villages and pass all of Guam's Catholic churches. It will be the first time the image will be taken down from its niche at the cathedral for other than the annual celebration of the Feast of the Immaculate Conception every December 8th. Archbishop Burns asked all faithful to remain united in prayer and to look to the model of deep faith and devotion to our Savior that our loving patroness and blessed Mother presents to us. The faithful are encouraged to stand outside their respective homes in prayer or even by the roadsides and, where applicable, wave should they see the passing vehicle carrying the statue of Santa Maria in Camelon. Everyone is kindly asked to strictly adhere to safety protocols related to COVID-19 and keep distances of at least 6 feet from one another. In the CNMI, as community testing continues there, Governor Torres tells KUAM that 71 people were tested on Monday. Community testing started with first responders and some medical workers on the 27th. An additional 153 residents were tested Tuesday. The total number of specimens collected in this community testing initiative is 224 for both Monday and Tuesday's process on Saipan. Overall, the CNMI has had 664 specimens collected, 388 negative results, 14 cumulative positive results that include 12 recoveries, and 2 deaths. They await 262 results. They are also preparing to bring community-based testing to Rhoda and Tinian. In national news, the Commerce Department announced U.S. GDP shrank 4.8% in the first quarter. The GDP is the measurement of goods produced in a country, and that slowed way down during the coronavirus pandemic. Natalie Brand is at the White House with why this could be just the start of what economists are saying will be some very bleak numbers.
The government says the U.S. economy shrank 4.8% in the first quarter, the largest decline since the 2008 Great Recession.
You know, it's yesterday's news. I don't want to belittle it because the next quarter is going to be much worse.
Just this morning, Boeing announced it's cutting back on production and laying off 10% of its workforce.
GDP growth in the second quarter is going to be, negative, big number. Wall Street estimates are negative 20, negative 30% at an annual rate. And so that's because we've done something that's really unprecedented. We've basically stopped everything.
President Trump wants states to reopen their economies as soon as it is safe to do so. He's meeting with Louisiana Governor John Bel Edwards today. The president also talked with food and agriculture executives this morning to address the nation's food supply. The president signed an executive order Tuesday declaring meat processing plants as critical infrastructure, directing them to remain open.
There's plenty of supply. It's distribution, and we will probably have that today solved. It was a very unique circumstance because of liability.
Many plants have closed as hundreds of workers have contracted the coronavirus.
Before they talk about reopening, they should make sure safety is first.
Analysts have warned of possible meat shortages at the grocery store. Natalie Brand, CBS News, the White House.
The United Food and Commercial Workers International Union says 20 food processing and meatpacking union workers in the United States have died from the coronavirus. In your Banking 671 report, brought to you by Coast 360 and the Bank of Guam, the Guam Bankers Association says they stand together with the island in the face of this pandemic and the economic impact it has had on our residents and businesses. They are working within the limitations each bank faces and are committed to doing their part to assist the community. To assist customers, they've offered deferral programs for all consumer, auto and residential loans and credit cards, offered deferral programs for all business loans and credit cards. They've collaborated to allow the cashing of stimulus checks for non-customers with no fee. This was to address the potential overcrowding, and agreed to not offset any of the stimulus checks cash to cover past due delinquent loan or credit card payments or any outstanding charges the customer may have. However, banks will have to comply with any other court-ordered garnishments. Again, that is your Banking 671 report from Coast 360 and Bank of Guam.
Thank you. That was definitely a deep dive into the day's COVID-19 news, 628, Thursday, April 30th. Hey, we got a poll question up on our KWAM News Facebook live stream. Thank you to Ken Sanity from the digital team there, esports legend. And that poll question: should cabinet members be allowed to stay overnight at a GovGuam quarantine facility if they're not feeling well? And there you go. That's your poll question up there. We want your 2 cents. Hey, give us $1. We'll take it. Okay, we'll take a little break, and we're going to come back with Sean Gumatautau from the COVID-19 response at 6:29. Guam's favorite, the KUM News Takeover. It's containing COVID. Good morning.
Try McDonald's new baked apple.
New self-storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc. Be healthy. Be informed with ITD.
win this war against COVID-19, it's going to take all of us to do our part.
We are all frontliners in this epic battle.
And on Tuesday, May 5th, we're asking you to answer the call to help by taking part in Giving Tuesday Now.
It's part of a global initiative to set aside this one day for the pandemic crisis.
To step up and give a donation to any of our island's nonprofit organizations.
The hospital, the Mayor's Council of Guam, or any of our frontline workers. Whether it's PPEs, gloves, masks, canned goods, no donation is too small. Anything and everything will help.
And if you make your donation, take a picture, post it on social media, and use the hashtag Giving Tuesday Now and Giving Tuesday.
Be healthy. Be informed with ITD.
Good morning. Yes, this is an election year for mayors and senators. That's from Yeti. Comment in our Facebook Live feed.
Congressional.
And congressional, yeah. Wow. Well, I think the only one campaigning right now is Congressman Michael St. Nicholas. It had his signs up. It's been up for since before COVID. Tough one. On a campaign in this election year, but probably not as tough as everything else we have going on with COVID-19. 6:34. It's the KUAM News Takeover, Guam's favorite. Let's bring Sean Gumatauto onto the show here. Good morning, Sean.
Hey, good morning, Chris and Bree. And I think Ken's in the studio this morning, right?
Yes, he is.
Ken.
Just for a little bit of background, Sean is the former Deputy Chief of Staff to Governor Felix Camacho. He's the head of the Joint Information Center at one point, and he's the managing director of Get LLC. Thanks, Sean.
Hey, thanks, guys, and I'm so happy to be with you guys. And I as we're the other day, we were talking about coming on the radio when we were discussing the 92-year-old survivor, and I was telling Trish, I said, man, I've never seen anything that I've ever shot or edited lead the newscast at KUAM since like 2002. So it was kind of cool, or actually 2003. So it was pretty cool.
Let's just provide a little bit of background because you're also doing work with the Department of Public Health, and that's one of the things that you did.
Yes, and so I'm our small business is providing public information officer support to the department right now, and one of the first projects I got to do is to get a chance to help them find through the public health nurses these survivors, and I got the privilege to meet the 92-year-old Elvira Cagle, and she was such a wonderful young woman, for lack of a better word, and got to meet her daughter, and of course just telling their story was a pretty big deal.
Yeah, it was. And so, Linda was mentioning that this is just one. I mean, there's 130 survivors now?
Recoveries?
Yeah.
Oh, yes, there's quite a number, and I know we have at least one more of those little photo or video essays coming through soon, and we're also working with other survivors, and so we're hoping to be sharing their story over the next couple of weeks.
Sean, I think that was a great first one because, obviously one of the running themes for this whole COVID-19 has been protecting our most vulnerable, of course, meaning our Manumco. So for you guys to roll out a 92-year-old COVID-19 recovery case as the first one that the island of Guam meets, I thought that was pretty special.
And Chris, it was she has had such a great story. Obviously, she talked about just the two places that she went to, and as we were talking a little bit before the interview got underway, she's just kind of doing her thing, on Guam, and it just was a big surprise, obviously, and you would figure the way she was talking to me, she was like 52, she's just doing her own thing, and it was a big surprise to her.
Yeah, what did she say? I get my hair done on Fridays, on Thursdays.
Exactly. And so it was, even as I was recording it, I just was just in shock with what I was hearing. But her story, and then also the support of her family, friends, and public health was also a big deal too. And I think sometimes, I know we've heard a lot of different stories across since the start of the response, and some of it hasn't been all great, but this 92-year-old woman, she was really just kind of to help kind of bring it all, home for most of us. I think we've all been home, including her.
Right, and just the fact that, I like the fact that her and Jackie, the daughter, were really just so thankful and appreciative of the phone calls and the constant contact with public health. Because you're right, you don't hear that. You don't hear this care that they provide, and how much a phone call, can impact somebody's life, especially when they're going through something like that.
Especially during these unknown times, right? I mean, they're not that it's not your traditional bedside manner that you're going to see from nurses. I mean, when they're making phone calls, obviously the COVID-19 situation is still very new and very contagious. And so, first responders and all the like are, they're really stepping into some really new territory, and anything can happen. I mean, it's just the same like yesterday. We were over at the last 2 days over at the community testing for COVID, and there's a lot of areas that were taped off, and people to stay away from them, and because if anything happens, obviously we don't want to infect even our own public health first responders. So I mean, it's new ground.
Yeah. So how did you keep it together when you were interviewing her and her family? Because I would have been a hot mess.
I would tell you, as you and Chris, we all have our Manumco in our lives, and all I was thinking about was all the Manumco in my life, and how can her story get to my auntie or my uncles that would be watching, or my father-in-law that are watching, my parents who are watching from an ocean away. And when they hear a message from a 92-year-old woman who lives in our backyard, and for the most part, she lives in all of our backyards, or down the road from us, it should be that kind of give us pause to do I go to the store today? Do I want to make a left turn and go and check out my friend? That's, I think, her message. I hope it gave folks who watched it 2 nights ago great pause when they're out doing their activities.
Yeah, and the fact that it really does, the support from your family, and not just public health, and then their faith, help them get them through this.
Yeah, no, I mean,
you can tell they're really.
I mean, even on your program, the Containing COVID program talks a lot about. I mean, you guys have spent a lot of time with Father, what's his name, Father Gofigan, and others who have been coming forward from the Archdiocese and other faiths and talking about the importance of it. Well, for them, for Elvira Cagle, faith is kind of right at the forefront of her life. So it does add that dimension to help her survive.
And good find, Sean, because I mean, Guam is small, and I think all the media has been looking for those recovered cases, or even any positive patients. And people talk about protecting privacy. They've done a great job of that over at Public Health in the response, because we haven't been able to find, almost anybody who has tested positive or recovered. So I thought it was important to get this story and this info out. I was wondering, so we have the recoveries, right? That's the positive side of it, to inspire people that, we can beat this COVID. Are there any plans to maybe touch on the other side? Because we do have people who have lost their lives from this virus.
No, that is such a great question, and I think, and that's also been part of the saddest parts of it, because of the way that the process is involved when they pass. It just seems so quick, doesn't give a chance for folks to really mourn or to publicly honor them. And I'm hoping that down the road that those 5 individuals who passed, that I'm hoping that some way their families or maybe even our community can give a little bit of remembrance, because without them, those were the examples that were set, unfortunately, as we're seeing all across America. As these are the examples that are either a couple things that are spurring more research. They are also forcing decision makers to, like in the case of our island, shut down an island and businesses. I'm hoping that they remember those people when they reopen, and then we try to get back to what would be a new normal for life. And we remember those 5 people with each passing day that, hey, this is very real, and our what we used to do prior to something 40 some odd days ago, those times have now changed.
Yeah, I mean, as you're right, we're starting to talk about reopening the island, and I know the church is they're putting pressure out there. So I'm wondering if we are going to see some type of memorial or ceremony, and is it going to be something that is done maybe collectively with all the families, or are we going to start to see maybe individual families organize their own? I'm curious, and I mean, it might be too soon to talk about it, but it's definitely something that I think about.
Yeah, and just think, Chris, it's not about just those families who, or those folks who died from COVID, but those who passed away during this response period, which made many people go, oh, were they COVID positive or not? I mean, these were just folks who passed because it was their time. Had nothing to do with the whole COVID outbreak.
Right. Yeah.
And so those families have also, they've really had to endure. And I think that the community as a group, we all should be very sensitive to that, and just know that what we, while we're grieving, and we might not think about everybody else at that time, but man, in a pandemic, the rules change. But I was thinking about this just about a week ago. Was the church, at least the Catholic Church, and we talked about this with them, or after, was that they've seen this before. I mean, if they look at the history books of the Catholic Church on Guam, in the Spanish flu in the turn of the century, priests had to do things a certain way. So when they did it at those times, it was probably not too far off than what they're doing today, advocating for the parishioners, making sure that they're safe, because at the time, the Spanish flu did take so many people, including my great-grandfather. So I can attest that some of these stories that you hear from that time are carrying over into today.
Well, Sean, we wanted to play the recovery interview you did here, just to kind of, I know we had it on the news. We dropped it on the show yesterday, but again, this is something that it's positive, and I think there's almost weird to say, like a voyeuristic quality to it. It's like you're kind of like fly on the wall listening to this old lady and her daughter talk about how they beat COVID. So we're going to do that. Sean, is there anything else you want to add in here before we let you go?
No, I just, just like we've all been doing is, continue to encourage everyone to be vigilant during this time. Wear your mask when you're out. Just try to stay home as much as possible. I know there's so many things that are happening, but, wash your hands often. And again, I think her message, I believe it's that hope that we're all looking for to get past this very challenging time in our community and in the history of our island.
Okay.
Thank you, Sean.
Thanks, Sean.
All right, guys, have a great day.
You too.
Work as usual.
Well, I thought I was coming.
Great, appreciate it.
Take
All
care.
right, wash your hands. 6:45. So yeah, let's play this recovery story from the Department of Public Health and Social Services.
Yes, the interview was done by Sean Gumatato.
Well, I thought I was coming from the beginning. I thought I was just coming down with a cold. And that's what I just thought, because usually when I have a cold, it just moves right in, it takes over settles in my bronchial tubes. And so I was expecting that, and usually what I grab is Zicam, and I take that during 2 tablets. In the morning it was gone. And then it still wasn't back to normal, the way I thought. And did I have a slight temperature?
One day.
And Jackie thought, no, I better take you to the doctor. We better go check and see for sure. And he put the swabs up my nose, and then we had to wait to send it to Hawaii then. and we had to wait. We didn't get it till Tuesday. And then they called and they said I was positive, and I was expecting always congestion. They keep talking about congestion in the lungs and the chest, and it just never got real congested. Just one day that I felt a little bit tight.
It's positive. I mean, I could have dropped the phone because I so did not see that coming. He had prescribed for her an antibiotic because one of her lungs looked a little bit iffy on some congestion setting in, and so she started taking that. And then when they called and said, you know, it's positive, we were just all so surprised.
A week before, I was only 2 places because I usually don't go out much at all. And that's why I really thought I was pretty safe. I go to the ladies' Bible study on a Thursday, and every Friday I go to have my hair done, to shampoo, and she sets it.
Something's come into our lives that I didn't want, and it was maybe fearful about. And of course, our children were saying, Mom, if Grandma gets the virus, Mom, if Grandma gets the virus, it's not going to be good for her. You know, we could not have her. And, you know, you're aware of all of that. And yet, what can you do? You know, you do your best and know God does the rest. And so it's ultimately in His hands. Our health always is, every moment of every day. So all of a sudden that comes home to you and your mind just starts going, okay, what does this mean for all of us? And especially, what does this mean for her?
So it was sort of in a way scary, but I felt so good having Jackie with me. And then we had access, they call from the health office, you know, that really meant a lot too. That we knew if I did really something happen quickly, we had somebody to get in touch with. So really appreciated the girls in the health office that were calling and trying to be of help if we needed it.
But really, there was never a fear of ourselves, and it was just trying to care for her, knowing that this could really be a difficult thing at 92 years of age to fight this strong of a virus. And so that's just what we did. We really started going through. And I'll tell you, one of the biggest blessings was that we didn't have to send her anywhere else to isolate. And at first we got that message. And when I heard that she was going to have to leave and go somewhere else, and we wouldn't even be able to visit, I thought, oh no, you know, that in itself, if anything, will be her downfall right there. She's so used to being with us, and we're used to being with her and caring for her. And without even a visit, I knew that would be so hard. And we prayed that night, God, you know, you're in control of all of these details surrounding this whole situation. You've allowed it. You have a plan for it. And so you show us.
What are your general thoughts on how public health supported you and your family?
They were very, super supportive right from the get-go. We started getting calls. We started hearing their concern. And they wanted to know whatever they could do to help us. That was really a blessing to us. Although we have some people around us that were willing to go to the grocery store and bring it to our door and drop it off or whatever, they were asking if they could do that. Can we get anything for you? And they checked in. My mom got 2 calls every day, morning and afternoon, to see how she was doing. The rest of us each got our own phone call to see how we were doing, always reassuring us what to do in case we had any symptoms, what to do if my mom's symptoms grew worse. And so we always were in the know, and we were always very supported by a group of people who were there for us at just a phone call away.
Now, we saw Nurse Kim earlier, so how has public health been in terms of your support to you?
Oh, I'd say very good. They're very good, very helpful. Just giving you a good feeling of knowing, well, they know more than we do. In the event that I did feel I really ran into some problem, but so it was just a support that they were, that meant a lot. And really, we appreciated it. And if Jackie had any problems or something, because this was the first adventure for us, and I didn't hear of anybody else going through it, so we couldn't go to somebody else that had experienced it, you know. And it was new, and it was an uncharted journey.
Recovery story there?
Elvira Cagle and her daughter, Jackie Nagencast.
Let's go to the phones here. We have one of my favorite doctors in the whole world, Gus Guam, Dr. Vince Akimoto. Morning, doctor. Good morning. I haven't heard from you in a minute. How are you?
How you been?
Yeah, you guys sound turkey this morning. Well rested. I'm enjoying listening to you.
Oh, thank you.
I slept really good yesterday.
I didn't.
Yeah, he woke me up.
Yeah.
Like, hey, did you see this? I was like, I'm sleeping.
Bree took a nap at like 6 o'clock, and then the whole world went crazy, and she woke up at 9. She's like, what'd I miss? I was like, well, how much time you got?
Well, so one of the reasons for the call, we were up late last night, too, talking with Dr. Mike, Father Mike Chrysostomo, Pali Mike, member of the group of Catholics who are trying to, work within this whole COVID-19 lockdown situation, which yesterday, I guess, added to the drama was an opportunity to perhaps allow the community to return to some form of normalcy. But I think the public health director, again, thinking about the safety of the people, I'm sure, gave the Catholic Church, I guess, a very firm no.
Yeah.
It sounds, at least from the news story from KUAM.
Let me, Doc, let me read you this response from, it's very short, but here we go. Yeah, so this is the response to Father Paul of the Liturgical Committee of the Catholic Church. Remember, they had, for those of you just joining us, they had written a letter to Public Health saying, hey, we want to start doing blessing of the sick and dying. We want to hold masses in the parking lots. We want to do a bunch of different things like confessions, baptisms, but we want to do them adhering to the many orders, with social distancing, wearing of the PPEs. And so I thought the letter, it was a good ask, I mean, it wasn't like they said, hey, let's pack everyone into the church and we're just going to ignore the rules and we're going to have our mass no matter what. They were very delicate in the way they had proposed these recommendations, and that's what they were. They were recommendations. And so Director DeNorsi writes, Dear Father Paul, this is in response to your April 22nd, 2020 letter regarding liturgical recommendations. I have read and appreciate your recommendations. DPHSS is identifying pockets of COVID-19 infection and interrupting its transmission within our community. The goal of eliminating COVID-19 involves expanding laboratory testing for individuals with COVID-19 mild illness and active case findings of the virus among the vulnerable population, especially those living in isolated areas. Moreover, social distancing is an effective strategy in reducing the further spread of the disease. Currently, the number of COVID-19 positive cases continue to rise, as evident in that there are 141 cases as of April 25th, 2020. Furthermore, Executive Order 2020-09 is still in effect, and it has not been lifted at this time. Thus, DPHSS neither supports nor approves any sacramental services, even though safety precautionary measures are in place as delineated in your letter. DPHSS aims to eliminate the further spread of COVID-19 among our community, and your support in these efforts is greatly appreciated. Lindo Unpinko DeNorsi, MPH.
I think the letter is written as if there was a robot and not a person at the other end of the thing. It's a great letter. It doesn't scientifically violate any, laws of science, but the real issue is the idea that you're going to eliminate the spread of the virus. It's the wrong model. The virus will spread. The virus is spreading, and our real problem is that we don't know how much it spread before public health finally allowed the people of Guam to get tested, despite the fact that doctors had been clamoring it for more than a month and a half. So I don't think public health suddenly became better or geniuses. They're just working harder. They have limited resources. They've been doing a lot to make up for lost time. Just like the national public health resources, where we can witness every day Mr. Donald Trump basically undoing a lot of the hard work of their scientists. I mean, I don't think the people of Guam should have any illusion, despite the good work of Ms. Linda DeNorsi and the hardworking people at public health. America's public health system, on a very high level, sucks.
Yeah.
They're very smart people who will sometimes fight with each other. But then when recommendations are made that make sense, the politicians underfund it. They don't understand it.
Yeah. I know we see it here, Doc. I don't know how many times I've seen Linda DeNorsi trying to answer a public health related question, and then the governor cuts her off or says, "Oh, can I just add something?" and totally unravels everything Linda said.
But I'm going to stand with our governor and say she's smarter than Donald Trump. I mean, at least she doesn't want to spray your lungs with Lysol. She might want to spray the room with Lysol, and that's not a bad idea. But Donald Trump wants to spray your room with Lysol after he sticks an extension cord and a light bulb inside.
Hey, Doc, we had a comment here. This is a zinger from Gemma. Good morning, Buenos Aires, KUAM News. My concern is, why can religious activities be denied, but a high-ranking government official is permitted to have a suite in a hotel room?
Oh, come on. You guys are listening to Candid News. Do you know they do a talk show like at 10 o'clock at night? And there's a lot of people. You guys should do a late-night show.
I'm sleeping, Doc. I got 5 kids.
Apparently you were waking up with Sabrina Salas. But the thing is that, and like you said, everything was happening last night. But
Doc, just quickly, what's your take on this church thing? I know you're very faithful.
What happened in the meeting?
You're the one trying to distract me.
I know.
Let him speak.
Okay, go. Okay.
I'm saying focus. The focus is that public health answer is scientifically, I believe, correct. If you want to live in a robot world where basically we have artificial intelligence and none of us ever, I guess, to exist as human beings, but we can have a whole bunch of, what do they call those, avatars interacting and doing our work, then we'll just follow that public health mandate, which, by the way, is based on a model that we're going to stop the virus spreading around in our community. That is a lie. The virus will spread. We want to control the spread, and we also want to make sure our healthcare system can absorb the care of very vulnerable people like the 92-year-old patient you just interviewed, because what a juxtaposition, right? Guam's healthcare system, and just the person from Guam, because we can't take all credit, that 92-year-old survived a disease that's supposedly going to kill her. And she accepted that, and she was afraid of it, and she didn't want to die. She's 92 years young. She's a brilliant lady, and what a great interview, and you guys did a great job there, but she did an even better job. She survived. And she shows you that 99% of people, based on current science, are going to survive this disease. The reality is 1% will die. And that's not assuming that public health does anything bad. There's still going to be 1% dying. Yeah. And this virus will spread around the world and infect more than likely everybody eventually. That's actually a good thing, because then we're supposedly going to be immune. And we never stop tuberculosis or influenza or any other thing from spreading. Now, I guess because we were able to control the mosquitoes that spread dengue around, we're also successful. But I doubt we did that. That's just nature and the fact that the people of Guam have herd immunity to dengue, most likely. But how would we know? Because when this thing whole started with, I'm not mad, I'm excited. The thing with coronavirus, COVID-19, our public health lab was broken. We weren't doing any tests. We weren't testing for dengue. We weren't testing for influenza because the damn machine was broken and public health didn't fix it. That was back in October, November. The reason they didn't fix it is because they were a little distracted. Their building burnt down. The reason their building burnt down is because their electrical panel exploded, and it exploded because they weren't maintaining it. And that building was probably supposed to be condemned by their building inspectors long before, but they're corrupted. They were ignoring all the signs that they should have done some preventative maintenance and done some public healthing of themselves. So now we're supposed to believe we're going to wait to open up the churches, the schools, and the rest of society once public health feels that they're doing an adequate job doing aggressive contact tracing and aggressive testing of the community. You know what? We will wait until we think things are going to be safer once we've had maybe about 10 to 14 days where there's decreasing numbers of people in the hospital using critical care medical facilities, sick and dying. We're going to be very worried if those numbers increase, and therefore the threat to the hospital being overutilized is there. So COVID-19 as an entity, the only reason I think we need to be very, very careful is it's going to kill you. It's going to kill, and that's the thing, is it is going to kill people. Let's be clear.
Yeah.
So the lie that we're going to stop the virus and no one's going to die from it needs to stop now. There's no one saying that that's possible. Dr. Fauci doesn't say it's possible. Dr. Osterholm, all these public health experts say you got to come to grips with the fact that in a good case scenario, 1% of the world will die from this disease over the next 18 to 24 months. So accept that and try to mitigate it. And if you get away with it, like I guess Germany's doing a good job. 0.7% of the people in Germany are dying. In Sweden, it's a huge amount of people, but they're living with it. I mean, everybody's just saying this thing's going to happen. Let's try to get on with life in some form. Singapore, Taiwan, they're able to mitigate death, but there's still death there. Japan is in a state of emergency, freaking out. I don't even think anyone's died in the last 10 days, but they're worried because they have a lot of 92-year-olds. For public health, tell the Catholic Church leadership that they can't have mass and that whatever they're saying, because that's what it sounds like, right? They don't approve it or whatever. It's just asking for a fight, because the Catholic Church has historically been rebellious of governments that try to restrict their ability to pray. And typically, they're willing to die for their faith, and I think most religions have had that challenge. And
So what happened during the meeting? Did you guys decide we're going to...
Here's my secondhand report, because I've been talking to all the right people. Yesterday, the governor met with the doctors. The doctors reviewed the data that really suggested that if you're going to open up mass, you're going to start opening up the economy. Yesterday would have been absolutely the best day to do it. Yesterday morning at 7 a.m. You know why? We have a crazy amount of military medicine on island. There are ventilators and ICU people and gear everywhere. I mean, it would be a great thing if KUAM people could actually get the exact number of how many military ICU units we have, but I'm going to guess it's close to 72. I know for a fact that GMH claims it has about 15, and GRMC has about 15, so that's 30.
We talking about ventilators, did you say?
Not just ventilators, but actual functional units, meaning that we could ramp up 100 ICU beds if everybody needed it at one time. Now the problem is that's it. 100 people at a time can get that sick, and what that would mean is then anybody, Mr. 101 is going to die.
Well, I know for sure they have 59 ventilators as per FEMA.
So FEMA is going to be usually going to be GMH, right? So, but you don't. It's like it's like having an extra car, but nobody really needs to drive it, because you don't need machines, you need people. And the real fear is that the nurses and the doctors would be overwhelmed as well and get sick and die. So there's nothing about this situation that doesn't need a whole lot of care and love. And I know Mr. Norcie, again, this is not an attack on her, because she's just a messenger. She's been working so hard to keep this thing going, and she is one of the stars. I've always been her fan. So for me to contradict her today is painful, but that's the situation that a government that has been historically poorly run in terms of healthcare, one that put us in such a deep hole with a burned-down public health lab, a non-functional machine to screen for dengue,
a leaking roof hospital,
and a hospital that never met the national standard for patient safety. We're supposed to believe that on March 25th, when we went into the executive order, that these are the guys, the people that run this big mess, are the guys that are going to lead us out. Not by yourselves, you're not. I mean, you guys are doing a great job now making up for lost time and not sleeping in your own bed, but maybe over at the Pacific Star in Presidential Suite. Way to go there, guys. Way to make things harder. You should resist the urge to pamper yourself during the middle of the pandemic when there are a lot of people unemployed. But hey, you know what? That's what you got to live with. Today, what we need to live with is the fact that the doctors yesterday at 7 a.m., a lot of them felt they had expressed to the governor that this would have been the best time to start having a reopening of the community in a way that gives people hope, something that lifts them up, something more than just letting people have a haircut or getting their nails done or engaging in commercial transactions. How about going to church? How about praying? How about coming together and see loved ones who are vulnerable and fragile and just smiling at them, as human beings do? This thing about, we've all been replaced by television sets and monitors, and that's not it. So I think as a community, it was an unhealthy move by public health yesterday to, and again, maybe they thought they were doing it gently, but that was a very harshly written statement in the fact that it really expressed nothing human. It just simply stated
We are in a public health emergency. You cannot pray. There is no gathering. There is no religion. There is no faith. There is no God, as you were.
So, that being said, you can kind of predict what Father Fully Mike and the Rabble-Rouser priest.
I mean, is
So,
this the
so
world?
what? Are we going to
our
say,
priest-
take your letter, shove it, we're going to have our masses?
Rebel
is that,
priest.
Is that,
Rebel
You
priest.
have the Archbishop coming on your show later on today.
Well,
so
he didn't confirm yet, and maybe
Oh, he
this is
didn't
why.
say-
Maybe he's like, I don't really want to go there.
He does do confirmation. He also does confession, and he does sacraments of the sick. And
But
we're going to need to go.
Yeah. Okay, Doc.
No, but so is that what's going to happen? Is that your feeling?
I'm just a doctor, damn it. I'm not a priest, but I'm just going to tell you that after speaking with Fully Mike and a couple of other priests like Father Paul Guffigan, they're definitely tomorrow. And they come from the tradition of Fully Duenas.
Right.
And these men would die for their faith.
Okay.
And so like the women that you were speaking to, because it's what a beautiful story. You guys should. Thank you for playing it again.
You know that public health actually did that.
No, and that's the other thing, right? Well, that took permission of those families, right? And I'll be honest, those people are our patients at American Medical Center. We knew of their story, but we really didn't feel it would be appropriate for us to bring it out. So good for public health for taking the initiative, because they don't normally do that. And I think they felt that was such an important story to tell the people of Guam, is that, one, that they did a great job, and I don't take that away from those home nurses and the whole crew that's doing the outreach. They're exhausted.
Yeah.
And they see so many things that are not working in people's homes. Dysfunctionality at home, a lot of people who are not taking responsibility. So when they have something like this, where a 92-year-old woman who's crystal clear, very strong, deserves every chance to continue to enjoy her life, we don't give up. We don't put her into quarantine and then, let her die by herself, because you could see the relationship between her and her daughter was so critical. Some people say, oh, you're old, just die. But no, we're not going to give up like that. This is a great community. It values human contact. We're not robots. So on the one hand,
we are not robots.
You got him going, Doc.
I got 2 wands, Doc.
Yeah, okay, he's going to start doing that dancing thing, right? But okay, so the idea is you and the Archbishop can do that when he comes in, because this is going to be apparently a very religious, a holy show. In fact, the understanding is tomorrow, people that maybe are going to be empowered or energized by this interview will have the opportunity to go down to watch the Archbishop say Mass on television, because apparently, as of yet, there's no plan to usurp the governor's executive order. And
they're doing the caravan, though.
Yeah. And Doc, we got to clear the line, because I'm trying to get the Archbishop to call in on. You're on the special secret line that nobody knows about.
All right. So let the Archbishop call in. But know that the doctors are meeting right now, I understand, at 7 a.m. with the governor, with the message that probably public health should have done this differently. And my understanding, as you can see, Dr. Wen was surprised that she didn't lift anything, and I think Dr. Mike Cruz had that same message. These are all people that pray. Let me let you know that the doctors
are not robots. Got you.
They value prayer.
Okay, Doc.
Thank you.
Appreciate it. Okay, so we'll get the Archbishop on. It's 7:09. Guam's favorite. We'll go and try and track down Archbishop Michael Burns, because there's all this stuff going on with, let the people pray. But there's also Santa Maria Carmelin. There's a big national, I think it's a reconsecration. Yeah, and so we wanted to get him on to talk about that too, as I think this is going to be, especially in this week, with the church making the ask, a responsible ask, really. I mean, they're saying, hey, we're going to wear the mask, we'll wear the PPEs, people know what we got to do. We've jumped through all the hoops, we've had all the virtual masses, we've really worked around this public health emergency. I mean, even in terms of burying the dead and anointing of the sick and dying. The church stopped anointing the sick and dying at the advice of public health.
But that reconsecration, it is at 5 a.m. on Saturday, and we'll be live streaming that off of our Facebook page, and also broadcasting it on KUAM Channel 8.
Right, and so basically, I mean, they're going to take the statue of Santa Maria Carmelin over at the cathedral in Hagåtña, and she is going to go around the island, and that is just something that is so needed right now. You thought that when they did that motorcade for the fallen service members, that you thought that was emotional. I really anticipate the island's faithful to come out and force.
Right, they're asked to stand outside their respective homes in prayer, even by the roadsides where applicable. Wave should they see the passing vehicle carrying the statue of Santa Maria in Camelin. Everyone is kindly asked to strictly adhere to safety protocols related to COVID-19 and keep distances, of course, of at least 6 feet from one another. And so that is occurring on Saturday. And so
Right.
we're waiting for the Archbishop. Right?
Yeah, so we're going to take a little break, and at 7-Eleven, it's the KUM News Takeover, Guam's favorite containing COVID. Good morning.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc. Be healthy. Be informed with I.
Jump right on the phones where we have Archbishop Michael Burns, of course, from the Catholic Church of Guam. Good morning, Archbishop.
Good morning.
Good morning.
I guess, first of all, Viva Santa Maria Camelin. Viva!
Viva! Yeah, there you go. You'll be going around the island.
Yeah, this is pretty amazing, and I think it couldn't have come at a better time. And, you know, what is, as we wind down this week, it's starting to look a little tumultuous on the, you know, with the discussion that's happening between the church and the government of Guam. We'll get to that, but I just wanted to give you the floor and, you know, appeal to the flock of faithful out here to come out and support Santa Maria Camelin.
Yeah, please do. It's going to be an early morning, but yeah, but that's just to get us in sync with the whole North American experience. Since Guam is north of the equator, so it's part of the whole North America. That's my take.
Right, and so this is the consecration of Guam and the Marianas Islands to the Blessed Mother, and you're right, it's in line with something that's going on nationally. Can you just kind of maybe take us back to the beginning and tell us how this all came to fruition?
You know, I think it came from Archbishop Gomez from Los Angeles. He's the president of the U.S. Conference of Bishops, and he put it out to you know, all the bishops of the U.S. and Canada. So and it's a kind of a, as you can see, as you would see in the prayers, it also has a real specificity to this time of pandemic, and so it's just another way of imploring the Blessed Mother's intercession in this really weird, extraordinary, and dangerous times. So she's the one we go to when these kinds of things happen. So
Right. Yeah, but I think what he meant was if you could take us back to the letter that was written to the governor regarding. Yeah.
Yeah. I mean, we could get to that, Archbishop. But first, we could wrap up this. I mean, not God. I don't want to say wrap up Sons of Recombinant, but so we're starting
the easy stuff.
We're starting at the cathedral at 5 a.m. This is on a Saturday, and then back at the cathedral 3 o'clock in the afternoon. And there are just so let me get this straight, Archbishop. Is it accurate to say you guys are stopping at every church on the island?
They will at least be going past every church of the island, but I think they will be stopping. I don't know that particular thing because as I looked through it gave me a kind of an understanding of the route,
right?
And it seems like really tight.
Yeah.
But they say that they've done it and they think it'll work out, and I think should be stopping at all the parishes.
Right.
Yeah, so
we have the schedule. We can actually post that online, so you don't. I mean, I wouldn't expect you to memorize the whole thing.
Right. Yeah. And
Thank you very much.
So, Archbishop, we know what you guys on the church side are going to be doing with taking around Our Lady of Sons of Recombinant. But what do you want the faithful to do on Saturday to support this?
Come and take a look. Maybe go to your church and just I don't know if we've really even thought through all that, but we'll definitely be going through the villages. So,
and what manner of procession is it going to be? Is she going to be up in a lead vehicle, and is there going to be a motorcade going on? And then, I mean, are we putting her in?
It'll be a motorcade.
Okay.
Yeah.
And how many cars are we talking about? I mean, because I'm thinking people might want to join this motorcade.
Yeah, no, for sure. Golly, I don't even know. I don't know what. I know all I know is the route.
Right.
Tell me the whole thing. So.
Well, the route, it looks like we're going from Hagatnia at the cathedral over to Tottu Immaculate Heart of Mary by 8 a.m. and then to Mongmong in West Sonora, and then Sinanya, Agania Heights, Maina, Adelup. You guys are doing a circle in Adelup.
Yeah.
And then
extra.
Little spicy there, Archbishop. Oh, frisky. Tumon, and then GRMC and GMH as well, right? And is this the intention of this for those who are sick?
Sure, yeah. No, we're trying to just get all the, our main stops, yeah.
And then Dedido, then Stumbo, Agafagumas, Jigo, St. Dominic's, Barragata, Mangilau, Chalampago, Ordat, Jotnia, Talafofo, Malolo, the Biba San Isidro, Inarahan, Umatic, Agate, of course, Molesto.
Going all the way around the island.
Right,
Chris.
yeah, so this is amazing.
And we'll put the schedule online.
Yeah. Has this been done before, Archbishop?
I don't know. You've probably been here longer than I have.
Well, I'm a young gun, so I gotta Google it. All right, so yeah, we'll put it out. Of course, we're gonna put the schedule out, and in asking people who want to join this motorcade, where do they go? And would it be wise for them to just pick up maybe at their village church and then follow from there? And
is it a motorcade, or are they just asking people to stand outside and wait?
Or is it both?
I don't know. Yeah.
Okay.
I think when you say you don't know, what you're trying to say is we're going to take her out. We're going to go around the island, and whatever the faithful decide to do is what they decide to do.
Very good. Yeah. Why would that be different than any other day?
Right. Okay. And so now let's get to the meat of the potatoes, the rice and finadeni, if you will.
Sure.
What about this letter that you guys had written to Public Health? And again, I read it through. I thought it was very thoughtfully put together. You guys had said, hey, we want to do these things, but we want to do them in a way that adheres to all of the mandates, the PPEs, the social distancing. And then you guys, the response was, it was short, definitely not sweet. It was a rejection of your recommendations. And so I guess just let's unpack that. And then are you anticipating any response from the governor?
Got some reason to believe that, in a little while we'll have some response from the governor, but at this point, the things that we're proposing, we feel like we can do. We're going to be meeting with our priests tomorrow. We have a Friday morning meeting with our priests, and so we'll be talking with them more about this. So some of the provisions we feel like we're ready to implement,
right?
And not be it wouldn't be with like approval, but we understand ourselves as being partners with our government, recognizing that the Catholic Church has the largest reach, organized reach of the people. And so, in the sense with all the parishes and the priests and whatnot, we touch a lot of people and can inform a lot of people. And so, but there's some things that we feel like are essential. For instance, the sacrament of confession. We feel like we could do that, maintaining, social distance very appropriately, by doing car window confessions with a priest, wearing a mask. And so we're going to be bringing this to our priests, because they've got to kind of buy in on this too. So we'd be ready to start implementing that. We have a number of baptisms that have been postponed, and baptism is the big, along with the Eucharist, but the big sacrament, and we want our children baptized, and so we think we can do that in a way that with purified water, and we can do it in a way with maybe up to 10 people, and then they can go and have their own celebration afterwards. So,
well, it sounds like you guys are going to go ahead and do what you want to do, and that letter was more of like a courtesy.
Right.
Yeah, and what it is a courtesy, because we, if we're going to be partners, because we've been asked to be partners, if we're going to be partners, then there's got to be a back and forth. And so we don't want to flaunt anybody or say that this isn't important. We think this is like really important, because a lot what we're dealing with, and God bless Miss DeNorsi, the kind of responsibility that she holds. God bless her for that's a big responsibility, and it shouldn't be all on her for sure, but that's she's in a real tough place. So we want to be cooperative, but we also recognize that the things that we do, some of the things are essential, and so we don't want to do anything that other than different, like when we go to Payless or any of the other stores, we maintain those distances, and so we can do the similar thing with some of these measures. We know that there are people whose weddings have been postponed, and I know weddings is generally are a huge deal, and it's like you would pack the church for a lot of these, but for the sacrament we really only need the bride, the groom, 2 witnesses, and a priest. We could manage, for those that are saying we really want to be married now, and not hold that up. We could feel like we can do that in a way that's not a large gathering, although it's a little bit inconceivable here, but
but you guys are willing to make it work. I think that's the main takeaway from this, is that the church and the faithful, not just the Catholic Church, people in all walks and all faiths have dealt with this hand that COVID-19 has given us, and we've gone on social media, and you guys especially with the cancellation of the anointing of the sick and the dying, and all these measures that you guys followed at the recommendation of public health. And I totally agree. When we have these businesses that are open and they're allowed to remain open and they're deemed essential and they're wearing the mask, they're doing the social distancing, faith is essential. I don't know.
Mm-hmm.
So basically, you guys are saying that we wrote public health, we wrote the governor, didn't get a response from the governor. You're saying that maybe you're going to get something this morning, but regardless of what that response is going to be, you guys are going to move forward.
Yeah. When are you guys going to start doing all of this?
We're going to talk to the priests because we need our priests on board. So we're going to be meeting tomorrow, and just to make sure our priests are on this because they're the ones that actually do it. So.
Do you have like a time frame though that you're looking at? I mean, obviously you wrote this letter. You would think that you would have an idea. Like, we want to start doing this, in a week or 2 weeks.
Well, some of these things we feel like we could do. We don't have it. Like I say, I don't want to say anything unilaterally, but we're going to talk with our priests tomorrow. Okay. I wouldn't. Some of these things we could just start Saturday or Sunday.
Yeah.
Depending. So
well, not Saturday, because Saturday is the...
Starting pretty soon, yeah.
Wait, so you're meeting Saturday? Is that after the consecration? Or
our meeting tomorrow, right?
You could do it. No, it's an early morning. So we can start doing, like, confessions.
Right. Yeah.
Saturday. And it just... But, like I say, we have to make sure our priests are on board. And then off we go. So I can't really make any predictions, beyond the ones that I've just mentioned.
Mm-hmm.
But Friday will be a big deal.
Mm-hmm.
Right.
Have you guys talked to the U.S. attorneys? I know that.
Yeah. So we did a story last night, Archbishop, where the U.S. attorney we confirmed that they had obtained the letters that you guys wrote to Public Health and also Linda Dorsey's response, and they forwarded them over to the Department of Justice Civil Rights Division.
Really?
Yeah. I can send you that. I'll send you that link to that story. So, I mean, obviously, the Civil Rights Division, it protects constitutional rights. One of the biggest ones is freedom of religion.
Yeah.
So you weren't aware?
It rings a little bell, but it didn't. It's not something I think I saw a headline.
Right. Yeah.
Mm-hmm.
Yeah.
Okay.
Yeah. Well, we'd put in a request to Tony to get a comment from you, but Father Paul had given us a quote, and I know that he was the one that wrote the letter and stuff. So.
No, he's been really good, and that committee is a very strong one.
I'm just looking at the optics of this. I mean, how did it end up being the church on one side and the government on the other? I mean, it's just that's not where. That's not where the governor wants to be. That's not where public health wants to be.
Yeah.
And this time where people are just starving for the scripture, for faith, for mass services, whatever.
Yeah.
How did it end up like you guys on one side and them saying, no, you can't pray?
Yeah. So now at the same time, we're committed to keeping people alive. Of course.
Mm-hmm.
We how much we do with pro-life. So. We're very serious about that, and so we don't want to get silly about the whole thing. But we want to do, if we're going to, but we want to share the same kinds of measures that other essential operations have to follow. We don't want. We're not going to. We're committed to, flattening the curve, and we think we can do it in a way that that is satisfactory for our sacramental work, but also to flattening the curve.
Right. Yeah. Well, keep us posted, Archbishop, because, we definitely think if you're going to allow businesses to do it and adhere to the things and remain open, then I don't see why the same logic isn't applied to spiritual services. So appreciate it, Archbishop, but we're going to get that schedule out, and if you want to call and touch base tomorrow before the big Santa Maria Comelin Saturday, let us know. We'd be more than happy to give you the floor.
Okay.
All right. Thanks, Archbishop.
Thank you, Archbishop.
You bet.
Wash your hands.
Will do.
Okay. 7:30. That's Archbishop Michael Burns. Moving quickly, we're going to take a break. We have Vice Speaker Talina Nelson on the line. Definitely want to get her onto the show. And also, we'll be speaking with Robert Koss from the Guam Federation of Teachers about this issue of COVID-19, hazard differential, double pay. We're going to kind of sort through all of that right here on the KUAM News Takeover of Guam's favorite. It's Containing COVID.
Be healthy. Be informed with ITD.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc. Be healthy. Be informed with ITD.
Self-storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Hafade Guam, Adriana Cotero here, and I am currently reporting from home.
Win this war against COVID-19, it's going to take all of us to do our part.
We are all frontliners in this epic battle.
And on Tuesday, May 5th, we're asking you to answer the call to help by taking part in Giving Tuesday Now.
It's part of a global initiative to set aside this one day for the pandemic crisis.
To step up and give a donation to any of our island's nonprofit organizations.
The hospital, the Mayor's Council of Guam, or any of our frontline workers. Whether it's PPEs, gloves, masks, canned goods, no donation is too small. Anything and everything will help.
And if you make your donation, take a picture, post it on social media, and use the hashtag GivingTuesdayNow and GivingTuesdayGuam.
And then later that night, make sure to tune in for our half-hour special Giving Tuesday Guam, Together We Give. We'll showcase how everyone is taking part.
a little spot, a beautiful island that you've never seen. Never gets old. 7:35 KUAM News containing COVID multimedia show. Good morning. Let's jump over the phones. Vice Speaker Talina Nelson. Good morning, Vice.
Good morning.
Hi, good morning. Good morning, Sabrina. Good morning, Chris.
I guess first of all, we want to just before we get into the veto and all that stuff, what are your thoughts on this issue with the Catholic Church asking public health and the governor for the ability to resume spiritual services and sacraments while observing all of the different mandates with social distancing and the use of PPEs?
No, I think it's very important because the people are suffering, and if God pulls us through many of the sufferings in our life, and if we can keep stores open, there's no reason why we cannot keep our church open. Mm-hmm. So I humbly, implore the Archbishop to continue to seek this, to allow the people to be able to celebrate the Eucharist. We need to know that God's presence is there, and we need to receive the Eucharist.
Yeah,
That's
kind of a no-brainer, right, Vice?
Yeah.
How do you tell the church no like that when you tell them the business yes? Okay, so now on to
for all denominations.
Right? Yeah, of course. Yeah,
for everyone.
Yeah. 7:37. So let's get into the veto.
Bill 326. This was your bill, right?
Well, it's passed by the 35th Guam legislature, so it's all of our bills.
Yeah, passed unanimously.
Yes.
Were you surprised? Shocked?
I was a little bit surprised. I'm disappointed. This was a bipartisan measure, and we worked very hard on this bill. We consulted with our legal, and it was about a day and a half that we took of session time to ensure that this bill was done properly. We didn't cut any corners, and it was a bipartisan measure. I'd like to thank all my colleagues for believing in this. But this is part of the democratic process, but this does not mean that we're going to stop advocating for these things. We're introducing another measure to ensure we get the hazardous pay, and we're watching very closely to see what happens with the double time.
Mm-hmm.
We're not going to give up. The people have put themselves on the line, and this is the least that we can do for those that have stood in the way of this, enemy, and provided this safe barrier for us to be able to live in. And so, this is the least we can do.
Vice, so what did you make of the veto message? I mean, it's just basically was... Sorry, that wasn't supposed to be a punchline, but the gist of it was like, okay, you want to pay the double? You want to pay the double pay? It's $36 million. If we pay this, we're going to have to furlough everybody, and guess what? Mm-hmm. It's going to be the senator's fault.
You didn't give us a funding source.
Yeah, so what did you make of all that?
Well, my grandmother once told me that no is never an answer. There's always a way. And so I'm going to find that way. And I hope that we can find a way to get at least the hazardous pay money to them, and then to ensure to see what this federal reimbursement on the double time will do. I mean, I've been guaranteed by people that work directly with FEMA that this is reimbursable because it's already in statute.
Right. And
so, we're going to keep a close eye on it. Yeah, that everyone has a technique.
Mm-hmm.
So, for those words, I have no words for those words.
Right. Yeah.
So just currently, what does the law allow when a state of emergency is declared? Because aside and separate from the Category 1 category, the sliding scale
Right.
payment that the governor was asking for?
Well, that was an executive order, the Category 1. So the law doesn't allow for that.
Mm-hmm.
What is currently in the rules, just the part that we've been really mulling over is the double time. So you either receive double time or compensatory hours when we go into a state of emergency, for those specifically that are helping directly with the state of emergency. And so, the option is the compensatory hours or double time. And it will be challenging for the individuals to take compensatory time off if they have to use it before the fiscal year ends. And so that's something that we're looking into, just in case the government gives like that option available, because they're saying that there's no money for double time.
Right.
Yeah. So
the law allows for it currently allows for and authorizes double time for essential workers or compensatory.
Is it the law, Senator, or is it just like personnel rules and regs?
Oh, it's a GAR. It's a GAR. I don't have it on me right now, the specific, but it's 8.406 in the GAR.
What GAR is?
The rules.
Okay. What does it stand for? I don't even.
I think Guam Administrative Rules.
Okay.
And that is a law.
It's codified within the GAR, which is a part of
the rules and personnel rules and regs, basically.
Right.
Okay. So it allows for the double pay. And
it allows for double time or compensation.
Yeah, I just feel like people look at us like we got three eyes when we talk about double pay, but I know that there are many government employees out there who have gotten it during emergencies, who have been expecting it.
Mm-hmm. And in autonomous agencies,
and they're not getting it. And, now I feel like the government...
so autonomous agencies have gotten it?
Well, I'm hearing that, I believe GPA, which they're giving it out. They made whole or something like that.
Let's see. What about the airport, the Port Authority?
Well, we're going to find out because we're going into Committee on Rules today to be able to have the ability to have virtual meetings. Mm-hmm. And so we're ready. We've alerted I alerted all of my oversight committees to let them know that we're going to have several budget hearings and also COVID response hearings to see so the people can see the work that they've done.
Mm-hmm.
What's the reaction from the administration, Vice? Because, they roundly rejected some bills from some of your colleagues that, called for more transparency. And I was thinking this morning on my way to work, so we have the public, we have mayors, we have doctors, we've got senators, all saying the same thing. There's not enough transparency coming from this administration. So you want to have these oversight hearings, these budget hearings. How realistic is it that you guys are going to get Lester Carlson, you're going to get Ed Byrne down there, or, on a Zoom or whatever?
Well, this is, I hope that they come without any resistance because we're in a state of emergency and, a lot of information is being left out that the people would like to know. And usually in times of emergency, people are calmed by more information where they understand the logic and the purpose of why you do things, where they see the mission and the purpose and the task that you're performing and the purpose for that task. And so it would behoove them to come and present themselves. I mean, we don't want to go with this back and forth and have to subpoena these people to be there. That's just, it's uncalled for, It's not a better practice to do, especially during these times. If we could just, be present, and if Lester Carlson can say to our face, there's no money, then I hope he's present to do that than just with the letter.
But what would your response be, though, if they were to come at you and say, well, we are in a state of emergency. That's why we're not giving you everything, because we are dealing with this state of emergency.
I think they have a handle, it's already after the first month. And so usually in the first month when you have a transition of some sort or you go into an environment that you're not familiar with, the first month you usually create a battle rhythm. And so I believe they have a handle on this battle rhythm. I believe they understand where this pandemic is going. I believe they understand that the resources are coming. And I'm sure they have a plan in place on how they're going to spend the resources. And there's federal guidelines for that, or the revenue, how they're going to spend it. So there should be a battle rhythm. We should not be living in chaos after the first month anymore.
Right. So you're saying, Vice, that
responding to the emergency, I don't think that's
not an excuse.
Valid reason.
Right.
Mm-hmm.
Right.
You're the vice chair of the Committee on Public Safety. Are you aware of any of those agencies under your purview have received the double pay? Because I believe some of them are frontliners and essential employees, like GPD, for example.
Right. So we have to double check on these things because we're not given the information, and that's why we're going to Committee on Rules to call these the chiefs forward and the directors forward to give an explanation.
Mm-hmm. No one's called you, though?
No one has informed me of that.
Well,
Isn't there a letter? Isn't there a letter that was sent to this dear governor?
Yeah, there was a new Dear Governor letter yesterday, Vice, and now, Adelup messed up because they responded to that first Dear Governor letter, and now every Dear Governor letter that comes out, they got to respond to it. And so actually, I'm going to go ahead and read this out to you. Vice, I don't know if you got this.
Did you see it?
No, I did not read it.
Okay, I'm going to read it out to you, okay? Whoever wrote this is on point. Help our first responders. Dear Governor, we feel abandoned in this war against the invisible enemy on our island, most especially after you vetoed Bill 326-35. Governor, you asked us first responders to help you. We are. You asked us to support your executive orders to keep the public safe. We are. We have given so much support that we leave our families to fend for themselves while we're on the front line in this mass time of fear and unknown in the world. Then we risk potentially exposing our families to COVID-19 because our government has no supply of PPEs. You still asked us to continue with the frontline mission, knowing we do not have the proper personal protective equipment. We have continued to the frontline mission day and night, waiting. You told us not to worry. COVID-19 compensation for first responders will come. It hasn't. You told us not to worry. Differential pay will come. It hasn't. So here we are in the front line of this pandemic, still waiting. I wait alongside my fellow first responders, forced to reuse PPEs for days at a time, forced to purchase our own cleaning and sanitizing agents because the government has no steady supply, and having to buy additional provisions for family and friends that help care for our children while we're on the front line. First responders make contact with hundreds of people in a single day for emergency calls and criminal complaints. Public safety agencies across the USA have implemented various types of differential pay and are actively paying their first responders because they're all aware there's a higher risk of exposure to frontliners. So here we are in week 7 of this crisis, still doing our part. Now it is time for you to do yours. Do what is right and compensate first responders as promised and as written in DOA's rules and regulations at double rate of pay. We earn the compensation and we've waited far too long. Also, if GovGuam employees are furloughed as a result of COVID-19, does this mean you'll create local stimulus or more unemployment programs? Asking for a friend. Please join me in sending this message to our governor. Copy and paste and keep this going. Help our first responders. So and I got a response from Carla Branch, who's Adelup's Director of Policy here. COVID differential pay is to be paid next week. The measure was vetoed to prevent massive furloughs or layoffs because of costs the legislature was not aware of prior to the passage of the amended bill. The governor also transmitted a bill to accomplish the goal of paying front lines retroactively to the start of the emergency. So I guess just first, what do you make of all that?
I believe it when I see it. And, yeah, we're trying on our end also to help our first responders, but we have been asking, especially Senator Terlahi has been asking about the status of the PPEs. And so that's a concern for me because we're hearing that they have enough PPEs, and I believe Sergeant Esteves is tracking that there's PPEs.
Right.
He's the one that's basically tracking the whole and the
inventory and all that. Right.
Yeah. So he says that there's PPE. So that's something that we need to look into because if there's someone that's in the front line that's not getting their PPE, then that's definitely where the chief or the director needs to come in and ensure that the safety of the people. Safety is always the first thing when you go into a mission. Mm-hmm. Is safety first, safety first, safety first. And if we can't provide for them the tools and resources for safety first, then we should not be sending them into that mission.
Vice, what are you hearing, though? Because I hear it, too. I hear frontliners say we don't have PPEs. You see it, and
well, we
just
got a
noticing
breakdown. We got a breakdown.
Yeah, we do. So maybe it's a problem with them getting them out to the first responders. I mean, are they sitting in a container somewhere? Because we could have 50 million PPEs, but if they're not getting to the people who need them,
they got 56,000 N95 masks, 25,000 surgical masks, 10,000 surgical gowns, 8,000 face shields, 93,000 gloves, 59 ventilators. These are all from FEMA. It's the breakdown that FEMA gave us.
But is that what
but
you
I
hear?
don't know what the surgeon cell has on their end.
Is that what you hear, Vice, that there are frontliners out there who don't have the PPEs?
No, I'm hearing that they are disposing of it. They even have one of the higher echelon people in GFP following them around, making sure that they decontaminate properly after a patient. So, I mean, I'm hearing that they have PPE, but if this is the case where someone is saying that they're not, then I'll call the chiefs this morning and I'll ask my colleagues for their oversight, who has oversight over the hospital and stuff, if we can really ask them if they need this PPE, because we're not hearing that just through this letter, and no one has, at least for me, no one has contacted me directly. But we'll get to the bottom of it.
What'd you make of this quarantine? The cost of quarantine, Vice Speaker, is as I'm pretty sure you're aware, there was a transfer of $7 million that was made on what date was it? April 2nd, and this was to address the mandatory quarantine protocol
And a temporary
and
hospital.
a temporary hospital program, which we don't. Does that even exist, Bree?
I don't know.
I don't know what that temporary hospital program is.
Yeah, and also this is what they took the
Maybe
$7
they're
million.
trying to build something.
Address mandatory quarantine protocol, temporary hospital program, and associated cost requirements.
And they took the money from all these different agencies.
Commission on Decolonization.
Charter school.
Charter schools, yeah. So that's $7 million, and then we obtained this document, basically an invoice from Pacific Star to Linda, and it's for a couple weeks here, and the bill's over $500,000, and so this was something that was sent out on March 26th. So I guess if you do the math, it's 1 point something million. Given to Pacific Star, who, coincidentally, I did the research. The family that owns this, they donated a lot of money to Lou and Josh campaign. So
Wait, that was March what?
March 26th?
March 26th. The letter came out on April 2nd for the $7 million transfer for
you got a little timeline here.
Well,
yeah,
you can see it yourself.
Yeah, definitely. So the letter to Pacific Star charging DPHSS $544,000 was written a few days before they took the $7 million from all the different agencies.
And I think you have to notify the legislature or whoever when you make a transfer at least within 5 days. Is that correct? After the transfer is made?
Yes. So Senator San Augustine is going to have an SES because he's very he wants to know also why this amount of money was spent and where all the money came from, because remember, we still also have an unknown answer for where did they take the money from for the war reparations. We don't know that either, and we're still waiting for the war reparations money to come in. So it does seem like our budget for FY 2020 is going to be greatly, FY 2021 is going to be greatly impacted. So the FCS meeting is coming up as soon as we solidify the new rules to go into a virtual. Thanks to Senator Lee, who's the community rules chair. She worked really hard to get our rules ready and the SOPs ready so that we can have virtual hearings. So as soon as that's done today, you'll see all of us in there having virtual hearings and getting the answers that we need.
Right.
Well, I noticed there was already one scheduled for May 6th. There was a virtual public hearing.
So I think that I don't know if they're going to do if they're going to enact that or if they're going to if they're going to move it to a later date, but it's going to happen immediately.
Okay.
Vice, we had a comment here on the Facebook page, and it was regarding the double time, and basically, man, it's way back up there, but this person had commented something along the lines of, okay, government employees, thousands of non-essential GovGuam workers are staying home, they're getting a paycheck. Essential workers are supposed to be getting this COVID hazard differential pay. Now we're trying to give them double pay. What about the private sector? They're kind of left out of the loop. Is anyone going to bat for the people who don't work for the government of Guam? Because there's a lot of those people.
Well, actually, in the hazardous pay bill, it included the private sector employees, those responding to COVID-19. And that was removed through an amendment from one of my colleagues. I can't remember who at this time. But there was some concern that the businesses we're not informed, and there's some concern whether government would be able to supplement it. And because the bill didn't have a public hearing, that's where we stood. And
and I think maybe
we are focusing on those that are out there. We're trying to. We don't know the answer and how they will be justly compensated, but we are looking. They're not left out of our mind.
Right. I just think when we asked the governor and she says apply for food stamps and there's no local aid and we're sitting on $117 million from the federal government that they said we can use for financial aid. They said we could use for mass feedings. But, every time we ask about it, it's like we get our head bit off. So that's what I think this commenter is saying is that, with private sector, workers who have been furloughed, displaced, hours cut, nobody's really doing anything for them, yet we're jumping over ourselves to give GovGuam their double pay they deserve. I'm not saying they don't deserve it, but I'm just saying you can see how people in the private sector are looking at this. Because there's no one's doing anything for them.
This is the time for information sharing, and we did we had this bill we had the unemployment bill, and we included those that were we included it to be a supplement bill also, which included those that were also furloughed. And we're not getting any information from Guam Department of Labor. We're not getting any information from USDOL, and now I'm hearing that there's a complex process before we can even implement any type of assistance through the pandemic unemployment assistance. And so really this is in the military sometimes they hide information, so I don't know. Anyway, so there's information.
Right. Vice, we're up against the top of the hour, so let me just ask you. We had Speaker Tina Munoz Barnes. She wrote a letter to Public Auditor BJ Cruz, basically saying, hey, get out there, go to these agencies, do performance, find out what the hell's going on out there. We've got you calling for more transparency. Senator Teresa Lai, the Health Committee chair, yesterday on the show had said that she's going to continue to hound these guys. Now you guys, it looks like you're mobilizing with this Rules Committee meeting. Is this a sea change in the attitude of the legislature where, before you had the Democratic leadership just doing whatever the governor said, and now it kind of seems like maybe they woke a sleeping giant? Is that what you think is going on with you and your colleagues? We have 2 minutes, Vice.
Well, I don't agree with the comment doing whatever the governor says, because many times I do not agree with the governor. I mean, you see it in the actions that are happening. But no, we've been asking for this transparency. Many of us have been writing letters every day asking for this information, and we've actually been working towards getting virtual hearings since a month ago. But there was concern about the constitutional impact, and we even met with the NCSL to ensure that we can have a smooth transition and address all of these things so that we're not challenged in a court of law later on. And so that was really the crux of the issue. How do we move forward with the virtual meetings because of our laws? And so I guess we found a way through that, and it took some time, but this is something that we've been wanting to do. We've been talking about it almost every day. My colleagues and I are on Zoom calls and trying to work things out and move forward to have better transparency. So it's always been there. You just see the movement now because we found the answers that we've been looking forward to move forward, to move through this. And so it was just a matter of how do we do it. And so we found the path.
Because like you said, where there's a will, there's a way.
Right. Yeah.
And now that all this funny business is coming out, where we're starting to see that people who are in are getting the benefits, reaping the millions of dollars. I think that there's blood in the water, and you guys gotta grow a pair, for lack of a better term, and do the job and really just hold these people accountable, because that's what the public wants.
Right. Yeah. That's what the people paid us to do, and we're going to work hard to ensure it's done.
Thank you, Vice Speaker.
Thank you.
God bless you. Wash your hands.
You guys.
Oh, you too.
Bye.
Okay, bye. Vice Speaker Talina Nelson there. 7:59. We're KUAM FM in Agotnia, Guam. We're going to flick the switch and jump over to KUAM TV 11. It's the KUAM News Takeover, Guam's favorite, containing COVID. Good morning.
Be healthy. Be informed with IT&E.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc. Be healthy. Be informed with IT&E.
Self-storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information. Online payments. Need assistance with your move? No worries. We got what you need. Also, a variety of storage spaces to meet your demands with ADA accessible units, plus 24-hour security system with individual pin-coded gate and door access. GU Self-Storage is located near Harmon McDonald's in the old GPA building. For more info, call us at 648-7867 from 9 a.m. to 6 p.m.
So Tus protegis languam contra peligro nafan safuham. Tus protegis languam.
Kids from Chug 807, good morning to our viewers on KUAM on TV 11. There's just so many ways you can help us contain COVID and kill the curve. Right here on the radio, 93.9 FM, Agotnia, Guam. It's I-94, Guam's favorite. There's also a live stream on KUAM.com and the KUAM News app. Audio stream, Docomo Channel 10. And, of course, we're on KUAM TV 11 from 8 to 10. And last but definitely not least, our Facebook Live audience. Thank you guys so much. We got a little poll up here. Should cabinet members be allowed to stay overnight at a GovGuam quarantine hotel because they're not feeling well?
Where'd that question come from?
That came from a story we did yesterday about the governor's chief of staff, Tony Babauta, staying at the Pacific Star. We got Linda DeNorcia of Public Health to confirm it, and
Janella Carrera. What did she say?
Janella Carrera's statement here, Bree. Let me get on this.
Because Linda said he wasn't. She got a call the day before, or whenever it was, and he wasn't feeling well.
Yeah, so she said that he called her, but then you had asked her how long he'd been staying there, and what'd she say?
I don't know.
That's pretty much what she said.
Well, she doesn't look at those details, basically.
Yeah, that was. I watched it again last night,
and she's very busy.
I just felt bad.
Handling a crisis.
I felt bad because it's like the administration, Adelup, they keep giving Linda these like stink bombs that she's trying to lead the COVID-19, and you guys keep doing your funny political business, and then y'all run and hide, and Linda's the only one that's left to answer it, and it just really undermines the public trust in her, the chief public health officer, who's supposed to lead this COVID-19 response. And so, Tony Babauta, the response from Adelup spokesperson, Janelle Carrera.
She's the communications
director. Yes, great job of communicating here. Tony was only at PacStar for one night because he wasn't feeling well. Aw, I added that, aw. That's what I said in my head. I was like, aw, little boo-boo. He was assessed and cleared the following day. And so I was like, okay, that's cool. I added it in the story. But, if this was regular time, we would have a camera. We would be able to say, hey, well, what about this? What about that? But, am I going to sit here and get into a WhatsApp war with a communications director who gives me a one-sentence answer? No.
Yeah, at least you get answers.
Yeah, I know. So, it was just kind of like we put it in the story, but if you look at what was actually said, he was only at PacStar for one night because he wasn't feeling well. He was assessed and cleared the following day. What does that have to do with anything?
Yeah. Well, for me, okay, so you have him getting a room, a suite, whatever. How many others?
Right. Yes.
If there are any others.
There's got to be others. Where there's one, there's many.
Okay.
And people are seeing it. The people are talking. The security guards, the National Guard. There's a lot of eyes on this quarantine thing. And so I guess what they're seeing these high-ranking cabinet members go in the underground parking, get in the elevator, go up. So, are we going to ask if there are more people staying at the PacStar? Of course we are.
Mm-hmm.
And so, that's one of the things we're tracking today. And that's why our poll question is, do you think cabinet members should? Hell no. What are you guys doing?
Yeah.
Like, people are sick out here. We're staying home. We're following your orders. And you got your chief of staff overnighting at PacStar because he's not feeling well? It's a bunch of BS, really.
Mm-hmm.
And then to not really respond to it, and you're going to throw Linda DeNorcia under the bus? How unfortunate for Linda. She's got the church on her back. She's got the people of Guam on her back over Tony Babauta,
she's too busy focusing on how she's going to do community testing.
That was funny. I'm going to put the clip on my Facebook because we did the whole interview, but I just had cut up the part where we had asked her about Tony. And you could hear the frustration in her voice.
Yeah.
But she's a trooper, man. She'll, she said, "Oh, Chris and Sabrina, you guys always ask me the tough questions." But, we were kind of hounding her on it, and her response was like, "For crying out loud, I'm trying to lead this COVID-19 response. And I got to answer these stupid questions about a chief of staff who doesn't have his head on right, that he's going to go overnight at PacStar, and you guys think no one's going to tell anyone about it? It's just ridiculous, and it's just unfortunate that with all this stuff that's going on, and we're seeing, and it's going back to Stephanie Flores in these, funeral pictures where you have an Adelup staffer violating the orders. What happened? Nothing happened. Tony Bavauta overnights at PacStar. Can you go to PacStar and say, you know what? I don't feel good. I need a tummy ache. Give me a penthouse suite. Oh, sure, right away, sir. You got it. Yep. How many towels you need? No. So that response, it's total BS because it's got nothing to do with anything. That's not the procedure at the government quarantine facility. It's got nothing to do with the procedure.
So please have an answer ready during this press conference today. You know what's coming.
Yeah, I know you guys want to unveil your plan, but I think the media's got other things on their mind. And it's all your fault. If you guys were available to answer all the questions, we wouldn't head into these press briefings media constipated.
Yeah.
We are backed up with questions. Boy, I tell you, I need my Adelup fiber just to clear my...
And while you're at it, because it's obvious that you guys pay attention to the Facebook live streams, there's a lot of questions from people that are watching, wondering about checks, unemployment, PUA, FPUC, the EIDL, all of this stuff. So maybe if you have time, since the governor has time to talk about her hair, it's obvious that she's following what's happening.
Right, and that's what people are wondering about it. And it is just the worst look ever.
People aren't stupid.
Yeah, they're and they don't think that you have a magic wand, so you could wave stuff away. And when you do stuff like let your chief of staff slide, what would have been the good response? I was talking to someone last night, Bree, and they were like, "Well, Chris, if you were in that situation and the chief of staff stayed at a hotel and da-da-da-da-da, what would you say?" Well, I wouldn't say that he only stayed there one night because he wasn't feeling well, and then he was assessed and cleared. Boy, I bet those people who are stuck in PacStar quarantine, I bet they wish they could be assessed and cleared in the morning and sent home. I'm pretty sure they wish that they didn't have to stay there for 14 days.
Mm-hmm.
I'm pretty sure they wish that they got the Tony Bavauta treatment.
Do we have somebody on the phone?
We do.
I
want to. But we're going to get Robert Koss, and we're just going to give it a little room here to let him social distance away from all the controversial things we were just saying. We're going to give you an audio 6 feet. Well, some people. Robert Koss, GFT. Good morning, Rob.
Good morning. Good morning, Rick.
How are you doing?
I am doing well. How about you?
Are you feeling well?
A little upset.
Oh.
But medically, I'm fine.
Okay,
that's good. Because we might be able to, make some phone calls and see if you can get a room or something.
Yeah, if you're not feeling well.
Well, I thought about that. They're paying for these rooms. They're vacant. Let's all go use them.
Hey, we got a homeless. We can't get the homeless at Paseo. Let's go.
There we go. That's the use. Put the homeless there. I'm down for that.
Or, these first responders who don't want to go home to their families because they're scared they got exposed. Maybe we need a bigger facility for them.
Well, that's a good idea, too.
Mm-hmm.
Anything's better than just leaving them empty and paying for them, right?
Right. Yeah, so, Robert, we wanted to bring you on to just kind of wade through this whole hazard pay, the double time. Yeah. What is GFT's take on what government employees who are currently working, essential GovGuam workers who are working during this pandemic public health emergency, what does the GFT think that they're entitled to in terms of compensation?
That's a very good question. When essential employees were initially identified and asked to go to work and face the COVID virus head on, while other employees were allowed to stay home and take care of and spend time with their families, we began receiving a lot of calls from these essential public employees. We asked that everybody cooperate with the governor. We asked that everybody do what they can, and let's pull together to defeat the virus. The important thing at the time was that everybody continues to get paid. That was the initial plan, and then later on, as the emergency dissipates or even ends, we could then focus on the lawful and legal entitlement for essential workers to receive double their regular rate of pay, plus what they're calling differential. We used to call it hazardous duty pay. So double their rate of pay plus hazardous duty pay for all hours worked during the emergency period. Well, we're not out of the emergency period yet, so we're still in that phase where we're asking everybody to continue to put forward that effort. But we're under a lot of pressure now because May 5, I suspect later today, the governor's going to say, we're reopening the government. I know she said little by little, so maybe it'll only be a partial opening. I don't know. But what's going to happen is the governor wants to retain her emergency powers. And if she retains her emergency powers, she has to retain the emergency designation. And that's going to cause employees to remain entitled to double their regular rate of pay as long as that emergency declaration is in place. So, the problem's about to fester. The problem's about to get worse. The governor says she's got it's a $36 million expense. Well, we've been in this thing for, about 6-7 weeks? So that's about a tenth of the year. So that's about $100 million the government would normally spend during this period of time. She's received 117, I understand, of 141. I disagree that there is not money. This administration has denied public employees their pay relevant to differential pay in every instance since they took office. This is not new. I came to them when they started, and they said, we will not stand for injustice of the previous administration. Well, denying employees differential pay was one of the injustices of the previous administration. I came to them and helped, and those problems are still out there today, unresolved, and now this. So this is not new. Denying employees differential pay is an ongoing practice of this administration. I really thank Joe San Augustine for stepping up now and following. We appreciate the legislation, Bill 326. That needs to be an override of the veto. But we're also going to offer Joe, any assistance we can to help him.
In Bill 326, this you said the law allows for the double pay currently, but Bill 326, there's that sliding scale of differential pay, the 25%, the 15, the whatever 10%. Is that in law also, or is that new?
Yeah, the way the hazard pay was restructured required that in order to get it, there would have to be some notification from an agency head, and this process that we went through where the governor outlined who's going to get what. So, I would say that's all fine and good. I think that the government followed the hazard pay policy, but it doesn't waive the emergency pay. Mm-hmm. When everybody else stays home and I have to go out there and work in a typhoon and go up in a bucket truck in condition 1, I would expect, that I would be rewarded with some kind of higher rate of pay. And I know all our public employees anticipated that those who were essential would receive that sort of pay. And changing the game or changing the rules or coming back with a lower rate of pay later on down the road, that's wrong.
Yeah, I was wondering what you thought of that, because it's like I keep hearing all the government employees saying we're going to get our double pay, and in some of these households where you have an essential government of Guam worker who is the only working person in that house, maybe the wife is furloughed, laid off, or whatever. So, I mean, this isn't like some freebie. This is something they've gotten, they're expecting, they're risking themselves and their family by going out there, and instead of the double pay, the governor offers up an executive order with that sliding. I mean, it seemed like a bait and switch, but it was just. Right. I feel like people knew, though. They knew they're going to get the double pay. So when the governor,
because that was already in law.
Exactly. So.
And then some of those employees were working, 4 12-hour shifts, obviously more than 40 hours in a week, and just bringing home their base pay. Mm-hmm. So. Yeah, there's a problem here. I don't know. Are we possessions of the government, or is it the people's government? Because they're treating us like possessions.
Mm-hmm. Have you heard? Because the vice speaker was on, and she said that she had heard that some of the autonomous agencies had received their double pay.
I have not verified with them, but I can tell you this. For all my complaints about the utility companies. they have a good track record in the past of properly compensating their employees during an emergency period. They provide double pay, and nobody's really been getting hazardous duty pay until now it's on the table. But as far as the double pay goes, yeah, they have power generation, things like that. These people are being compensated. And so, you know, I haven't verified relative to the COVID. I did talk to them early on because I had heard that possible power generation employees may be required to sleep at the power plant. So I wanted to understand that better.
Were they?
Only if it gets to the point where, you know, there's going to be an absolute lockdown and they would not be able to come in or go out to work, you know, in a real severe situation. I believe GPA did plan for a worst case scenario.
So are you planning to see a surge of first responders, essential workers come in and file complaints with GFT? Or have you already?
Represents kind of a big challenge.
Why do you guys sue? How come nobody sues anybody?
Are you standing up an online portal?
You guys have no idea how complicated that is. We're talking about violations of rules and regs, subject to the grievance procedures. Then the AG's office will argue it's not subject to the grievance procedures.
Right, yeah.
But when you get to court, the court's going to say, did you exhaust your grievance procedures?
Yeah, okay.
Yeah, and there's no class action. So everybody has to do it independently, which means I'm looking at 12,000 individual grievances if all employees were to file. And come Monday, if she sends everybody back, all employees are going to be on this list.
Oh, my goodness. So, again, are you standing up some kind of online portal for people to file something? Or they just
right
email
now,
you? Or GFT?
Yeah, there's a lot of communications between various parties on, you know, how best to address this. And I really think our legislature is the key. We had unanimous support for Bill 326. I'm asking our senators to continue with that unanimous support and override the veto. I do not believe public employees need to be furloughed, that is just a retaliatory comment from the governor, but that there is sufficient money. There's more, she's been provided more money than the cost of the COVID so far.
Wow, pretty strong, Robert.
Well, we gotta be, right? I mean, look what we're up against. You know, clearly the governor has all the powers. She has superpowers right now.
Yeah, but I want to go to what you said about the threat, the implied threat that, oh, okay, if we're going to pay this $36 million, then we're going to have to furlough and lay off these people, and guess what? It's going to be the legislature's fault because we told you.
No, it's not going to be the legislature's fault. That's going to be a decision the governor makes, and a decision the governor is going to be held accountable for.
Right, but they're going to spin it like, oh, we only had to do this because these senators, pesky senators.
Well, yeah, I can't help that. They'll probably spin it and make me responsible.
Well, you don't got to be held accountable to the voters, so I don't know. I don't think you got anything to worry about. Robert?
In a way, you know, I do. I'm accountable to my members.
Right, yeah. But, I mean, people here, you're trying to do the right, what's right, so pretty sure you got the backing.
Yeah, we don't change the rules of the game in the middle of the game. We learn that as children.
Okay. Well, senators are meeting virtually at, was it 4 o'clock today?
Yeah.
And I think they were talking about this might be brought up.
Are you planning on writing to the legislature? Are you in contact with, I know you mentioned Senator St. Augustine, anyone else? Is there going to be something official on a GFT letterhead maybe coming out?
Well, we've had a lot of success with what I call our network. So we're going to go ahead and continue to rely on our network and ask that everybody do their part, and let's try and get this done. Go Senators! You know, the ball's in your court. I think everybody agrees, you know, what's the right thing to do except for our governor. So, you know, let's go ahead and do what we have to do and get the law in place.
Say that law, though, is not overridden and nothing's done. What about just the issue with the double pay that's already due?
Yeah, so that's what our attorney is for. How do you go about suing the government of Guam or getting a writ of mandate to compel the government to pay wages owed? Department of Labor, what are the penalties for refusal or failure to pay wages to employees when owed? You know, there's a number of legal considerations there. And, you know, everybody's going to be owed a different amount. We don't know. Well, we do know, I guess. We could figure out who all the people are who are owed. But I think something like a class action lawsuit, writ of mandamus, we'll see. I haven't spoken to the attorneys yet.
Okay.
Why don't you guys just do some videos? You know, Governor Lou didn't give you your pay. It was a pandemic. You were out there responding, but you didn't get your pay because the governor didn't want you to get your double pay.
I'll make that recommendation, but we got to find somebody better looking to be in the video.
I'm pretty sure you got some pretty hot first responders out there who would be more than willing to. All right. Hey, Robert, thank you.
Thank you.
Thank you.
All
Thank
right.
you for all your help. You guys have been wonderful.
Appreciate it. Wash
Take
your
care.
hands.
Bye-bye.
Bye.
Bye.
Robert Koss. Man, wow. I'm just impressed with what he had to say because I'm always on him, you know. There's so many issues, and I cover a lot of this the government employee stuff, and so when we get a personnel action or the way they did Linda Huggan, I'm always just like, come on, Robert, you got anything to say? GFT. So I'm glad that they came out, and those pretty strong words.
Mm-hmm.
Pretty strong words. How do you spin?
Legislature, it's in the ball's in your court. And they're going in, I think it said 4 o'clock, right? Did I say 4 o'clock that the Rules Committee's meeting? They have to approve how they're going to do virtual meetings, but they're going to meet virtually at 4. I want to make sure. And you can actually watch it. There is a link. Yeah, they're meeting at 4:15 today. And according to the Vice Speaker, they will probably be talking about what they're going to do. Because, you know, usually when they meet in a Rules meeting, they talk about, session, what they're going to talk about during session. I'll have to find the link because I'm not sure if this is going to be on YouTube. It usually is on the Guam Legislature website, but it will definitely be on the Legislature channel on TV.
Let's go to the phones. We got Minority Leader Senator Tello Taitagui on tap. We're also going to try and get Antone from the Department of Corrections, the Public Auditor BJ Cruz. Adriana Quintero is going to jump on and tell us what she's been working on there. And Rachel from, actually it's going to be Felix from Public Health to come on and the ECHO team and talk about mitigation measures. But I wanted to bring this next caller on anonymously. Ma'am, you don't have to give your name, but I wasn't able to hear exactly what you said, but I did hear that you were one of the workers who was tested at Estumbo. Can you give me more background on your situation, ma'am?
Well, I know that we were tested yesterday because of the one positive.
Okay, so let's just go back.
At Estumbo?
Are you with the Grab and Go Meals program or
Yes.
GDOE? Okay.
Wait, so Estumbo or FB Leon Guerrero?
Remember, they were told to go to Estumbo and get tested.
Oh.
Yeah. So is that what happened? Is after there was a positive at FB Leon Guerrero, were you guys instructed to go get tested at Estumbo?
Yes, we were shut down and we were instructed to go get tested at 3 at Estumbo.
Okay, and then?
The thing about it is, how does the media know that there's no negatives and we haven't even got called yet about it, if we were negative or positive?
I don't know.
Nobody called us. I haven't got word for myself.
Right.
Mm-hmm.
Well,
You
ma'am,
know?
Maybe they only call if you're positive?
No, they should be calling everybody, but the media, as of late last night, they know that we were, tested, but they're saying there's all negative, but us being the one tested, or myself being the one tested, haven't received a phone call yet.
Right.
Yeah, we can find out if the number
Included.
is included, because there were, 110? And then when we asked GDOE yesterday, how many workers total and volunteers, and I believe they said 60, so.
It's about, because you have to remember Sodexo, FB staff,
And
AmeriCorps.
and
Ma'am, did
yesterday's testing was for everyone.
Right.
So you mean to tell me that only 50 people showed
So
up?
all 60 of you guys went over to Estumbo? How many of you guys went over there?
Well, I can't give you the exact amount, but majority of who I work with
Mm-hmm.
in the workplace, we were there.
Like, give me a ballpark. 10 people, 20 people?
Oh, no, maybe. I'm not too sure how many cafeteria staff we have working there, because I know there's a handful of them.
Right.
And then there's about maybe 25 of us, and then also AmeriCorps, the mayor.
Wow.
yeah.
Sorry to interrupt, ma'am. Real quick, guys. Speed trap, Barragata before Wendy's. Heads up. Okay, as you were.
And the funny thing is, your governor showed up yesterday.
Your governor?
Osumbo?
Yes.
Mm-hmm.
And it's crazy because we're all, in line, we're GDOE workers. So, of course, we're pissed off about the veto, So
Which veto?
The 320?
The hazard.
Right.
Okay.
So, she was walking with, what's her name, Linda?
Linda DeNorsi.
Yeah. And so, I don't know if she felt it, but, the whole line was just, looking at her and didn't say anything, and then Linda's like, say hi to the governor, and we're like, whatever, kind of thing. And then one of my coworkers was like, so are we 10% or 15%, and how can you have the governor lie to you in your face, knowing she already vetoed that bill? You know what I mean? And she's like, where are you guys from? And we're like, GDOE. And she's like, oh, you guys are the distribution. We said, yes. And she's like, okay, you guys are 15%. And of course, we're like, not thinking in the right mind, we're like, yay, whatever. But she already vetoed the bill, so why would you just lie to us to our face?
I think there's an executive order, though, in place that is going to give you the percentage that she was talking about, but from what we understand, it hasn't been paid yet. The response from Adelup was that it's going to be paid, so.
Okay, so it's just, that's my thing. They're putting out last night, late last night, that there's 0 positives, but yet the people who were tested yesterday, well, I was tested yesterday, let's speak for myself. I was tested yesterday. I haven't even got word if I'm negative or positive.
There was a comment here from Angelica on our Facebook. From my experience, you have to call them 24 hours after. Then 5 days after I tested for COVID-19, a nurse from GMH, Communicable Diseases Office, calls to let you know your results. So either you call or wait for them to call you days later.
But is that fair? You know what I mean? Is that fair for us? You tell us to go get tested, yet we go get tested, and now we have to call you. Actually, we're waiting on everything. So I guess, it's not.
What can you tell us about the positive case, though?
Actually, we really don't know anything, a lot of information. All we know is that one of the employees were tested positive because he was he was, I guess, point of contact with somebody who tested positive. So then we had to shut down and go test that tree.
Who told you guys that? Who came to FB Leon Guerrero and said, hey, everybody?
So and so, or this person.
Well, actually, it goes by chain of command. So of course, it's going to be our principal that is talking to upper management, but we had a meeting to shut down, and that was it. And 3 o'clock, we have to go get tested.
Okay.
Yeah.
Until this day, no word, nothing. I mean, it just kind of sounds like what we're hearing every day from everybody, that there's just no information from the, from the mayor's council, from senators.
We have children at home, too. We have families at home, So we have to self-isolate ourselves to protect our children. And it's crazy because, I don't know, it's just crazy.
Did you try checking into Pacific Star? Are you feeling well or you're not feeling well?
I'm feeling okay.
Let me do an assessment. Are you feeling okay, but are you feeling well?
I'm feeling well. It's just, it's mind-blowing. How can you go put out negative results out there, but yet the people you tested have not been called?
Right.
Yeah,
and according to the Joint Information Center, their press release, the results include samples from the COVID-19 expanded testing in Osumbo Delgado. Whether it's all of them, we don't know. So.
Yes, and that's what I read too, with our email. But at the same time, why don't you tell the people you tested before you put it out there in public? Give us some peace of mind. We don't know if that was testing from 2 days ago. We don't know if that's our test. We don't, you know what I mean? It's crazy.
No, I know.
Totally agree.
Yeah.
So what now? What now are you,
I guess we're shut down until further notice. So all I know is that through the media is that, they have to clean the school, sanitize the school.
Hey, what can you tell us, though, about the person who tested positive? Was it somebody who works for the Department of Education, or was it a volunteer, or was it somebody who works for Sodexo?
You know, I don't know if I don't know if I'm allowed to say it, but you know, I know that it was in the cafeteria.
It was in the cafeteria. So what are you trying to say? Just say it.
The cafeterias, that's where the Sodexo people work?
Yeah.
Okay.
Okay.
So yeah, Sodexo employee. So you know, it's kind of heartbreaking for us. We put our lives out there, and then yet, you know, it's scary.
Yeah, and you guys do wear your masks and your gloves and so on.
Yes. So we have hand sanitizers. You know, we have to wear our masks, and you know, we're around the same people since it first started. You know, so it's really scary.
Yeah. And I mean, ma'am, you guys have been doing a great thing with the grab and go meals. I mean, for you to be involved with that, I was around a couple of the sites. Really, I mean, I can't thank you enough, and it's just so unfortunate and tragic that this, you know, chain of events has hit FB Leon Guerrero. I don't want it to, throw any shade on the rest of the grab and go meals program, but this is something that people have talked about from the beginning. You know, it's a massive operation, and there's going to be a risk.
Yes, a big risk, and the thing about it is us workers, GDOE workers, maybe we may be at the bottom of the line, but the point is, because we work with these children, we feel for them. You get where I'm coming from?
Yeah.
So we're not going to deny our services because we know how it is out there too with the kids that we work with every day. We're going to have heart. We're parents,
Yeah.
It's crazy.
Well,
maybe she doesn't understand that, but
yeah. Well, appreciate your calls. Is there anything else you want to add in here before we let you go?
For everybody to stay safe and wash your hands.
You too, okay? Wash your hands.
Okay.
And keep us posted if you get results. If the public health calls you, shoot me a message, shoot us a message, or try and call in, okay?
Okay,
Can I just ask you one thing? Yeah. How many people usually come through FBLG for a grab and go meal?
I think our count, I have to say,
over 100.
More than that, because now that the limit is 10 per car, we got pretty much. Lately we've been only declining maybe 20 cars or less than 20. I guess it really depends on what the meal is too sometimes.
Right. So you guys are giving out hundreds of meals.
Yeah.
Basically, right? Yeah.
About more than 1,000 meals.
Okay.
At our site.
So that's a lot of traffic.
It's a lot. Yeah. It's a lot.
Okay. Yeah. So I was just wondering are they supposed to go to another site?
I believe that's what. Yeah, I guess that's what they said. I'm not too sure of any other details about where they're, So that's added more to Dedido because we're the only one in Jigo.
Right.
So it's pretty rough.
Well, thank you for calling us.
I'll put you in my prayers tonight.
Thank you, guys.
I'm going to say, pray for Miss Anonymous. Thank you, ma'am.
Right.
Thank you.
Take care.
Wash your hands.
You too.
Okay, bye. 8:40. Let's keep it on the phones here and go over to the Guam legislature again and catch up with Minority Leader Senator Tello Taidagui. Good morning, Senator.
Good morning, Chris, and good morning, Sabrina.
Good morning.
And happy belated birthday as well.
Oh, thank you.
Wow, so the theme of the day, transparency, transparency, transparency.
Yep.
Lack
exactly.
of, in parentheses, lack of transparency.
Absolutely, and lack of involvement, most especially with Bill 326, the double pay. What gets me is that, well, some of us don't have the, opportunity to call the governor right away and get a response right away like some other senators do. So I'm just surprised that during the debate on the floor of Bill 326, why didn't she call us while we were debating this? We were in session for 4 days. Actually, we even had a weekend break before going back into session. If the governor had reached out to somebody, or she should have, saying that, hey, wait a minute, that's going to cost us $36 million if you put this in legislation. And she had every opportunity, the administration had every opportunity. Where was Carlo Branch? Did he make a call to say that it's going to cost that much, and then now they're, saying the sky's going to fall down. That's a classic word. Remember that? The sky's going to fall?
Right, yeah.
But, so they had every opportunity to do it. And I was listening like I do usually if I'm not on the phone with a constituent or working out, which I love doing when I'm listening to you guys, is working out and hearing what you have to say. But, what Mr. Ross had said from GFT, he's absolutely on point. It will cost a lot of money to go through a class action suit. And I myself have gotten calls, from a guard over at DOC with regards to double pay, even before she vetoed the bill. So this whole issue with Bill 326, she should have told us. But, I'm anxious to see now if they're going to be involved in any kind of legislation moving forward. And that's something we should have done too, is I was hoping that the Vice Speaker, it was her bill, to reach out to the administration for any comments, considering all these bills didn't have a public hearing. So that's my take on it. But I guess I'm calling because of the press release that I sent yesterday with regards to asking the Attorney General, which that's another thing. Senator St. Augustine sent a letter to DOA, Director Burns, when I think he should have sent another letter to the Attorney General's office to ask, with regards to the double paying, what's in the GAR right now.
Yeah. But they're only open for like an hour or something, so you got to hit the office, right?
Well, nothing wrong with an email. That's what I've been doing.
Yeah.
And I did send a letter to the Attorney General, still asking the question of, does the governor have the authority to spend any excess revenue? And that question hasn't been answered yet. I received a letter back in February or the beginning of March asking her the question, where is it in the law that she has the authority to spend this money? I received an answer back, and then I also seek legislative counsel, their opinion, and it's total opposite. So I have two different opinions. Now it's time for the Attorney General to give their opinion whether the governor has any spending, because she's been claiming that every time we put out a bill that show me where the money is. Well, if you were not supposed to touch that money, we can show you where the money is. That was $23 million of excess revenue in FY19. And that money could have been used to help put stimulus in our economy, to help those people who are in need right now. But so I'm hoping that message or that answer comes in from the Attorney General. He has 7 days, according to the law. The Attorney General has 7 days in order to answer our question.
Oh, I wonder what the AG would say, because I feel like he's just been a rubber stamp for the governor. So.
Well, I think after that latest throw him under the bus scenario.
You think he's still mad about that? He's like, okay, I got an opinion for you.
Well, I'm hoping so, and I'm hoping he stays true to form and an unbiased opinion, but because his reputation would be on the line. I mean, if we take that and go to court with it, and the court finds opposite of what the Attorney General says, then that would not hurt his election, his next election, I think.
I think it's already kind of hurting a little bit.
I think so too. Yeah, the way things are rolling, letting people out of jail or not even go to jail, or
and just really being inconsistent with enforcement, with a preemptive looks at what the administration is doing. I mean, let's just call it like it is. Everyone out there thinks that Attorney General Levin Camacho acts like an appointed Attorney General and not an independent elected one.
Absolutely. I've been a great advocate for the Attorney General's office, even during the budget hearing, to provide them everything that they need. But I think there might be some legislation coming down the line with regards to opinions and the Attorney General's responsibilities. Hopefully soon. We're putting something together. We're just anticipating, waiting to hear the opinion from the Attorney General coming back from this one. But that letter went out, as well as another letter I sent out earlier this week, to the governor to ask her what's going on with the Guam Pandemic Plan Review. That 3 days at the Pacific Star, once again, the Pacific Star is up. How much money did we pay for that? And what was the takeaway from all those meetings that she put in place. And, you're looking at other countries and what they've been doing. I was reading and looking on YouTube about Sweden and how they're moving forward, how they never had a lockdown and keeping their economy going. So I'm curious to see what some of the takeaways of those meetings was during the symposium, because we haven't heard anything. It just went dead.
Oh, you're right. I forgot there was a pandemic plan symposium kind of way at the beginning of all this.
Yeah, 3 days. And
There
we
was
haven't heard
supposed to
anything that came out.
I thought they had a deadline, like let's try and get this pandemic response plan, redo it or something, because we already had one.
Yeah.
Well, the only response I received from the governor's office so far is that, we received your letter, and that was it.
At what point is the legislature going to say,
enough is enough?
Enough is enough. We know, you guys know where she is at 1 o'clock every day. She's over there at her office because she's holding a press conference.
I mean, you guys are cruising for a bruising.
You guys can ask questions by just showing up and say, hey, we want some transparency here. I mean,
absolutely.
You guys probably won't get muted because they can't put a mute button on you, but they can do it over Zoom.
Yeah.
Absolutely. Well, we're not going to give up, that's for sure, with regards to trying to seek questions. We put something out there every day, send letters to her. Even in the last letter, I requested that the last time she had a meeting with all 15 senators was about 3 weeks ago, even more now. And we had yet to have a meeting with her. So why doesn't she want to meet with us? That's because she's afraid that the questions we're going to ask that she won't be able to answer, or that she's going to not give us the true markings of our financial condition. The responsibility of the legislature is on the financial side. It's our job to look at the finances and find out where we can adjust. And definitely, we know that there is a shortfall, but we also know that there was funding earlier on. The $30 million excess on the first quarter, there was $30 million over projected revenues on the first quarter.
Mm-hmm.
Then, of course, you have that $23 million in the excess revenue FY19. So that's funding right there. And where is that funding? And then, of course, the big question about the war claims. Where the money's not here, but where did you get that money from? Now, they said some of that money came from the Medicaid reimbursement, or with regards to where we were relieved of having to match the funds for that.
Mm-hmm.
So there was a response to that they used it. I think it was in an article. That's what they claimed. But we know that there was more money other than the $6 million of savings. I think it was $6 million, if I'm not mistaken, in reimbursement to the Medicaid that we were no longer responsible for. So a lot of unanswered questions. And if you watch the public hearing, when we did have Lester Carlson there, that was just like he's one of the best people to answer a question and not give you an answer. That's why we don't like him coming to the floor. I mean, Director Byrne, he just outright tells us, well, Senator,
And I don't know what is it with Byrne, but when you say something with a British accent, I just kind of believe it. We don't have any money. Oh, okay, sir, sorry.
So true,
thank you.
Yeah.
The finances are in disarray. Oh, okay, sorry.
There is no shortfall.
I think this time,
There is no. See, if Lester Carlson says it's like whatever. Ed Burns says it. There is no shortfall or no surplus either. Oh, okay, sir. Radio.
Absolutely. So, I'm just really curious about why the governor did not, or the administration. Carlo Branch, who's supposed to be the legislative liaison, or someone up there should be on I was once the legislative liaison, and they did not speak to us during the whole time we had session, and now they're crying wolf. And it's unfortunate because I think what's going to happen is there's going to be another class action suit. Like you said earlier, I mean, why isn't anybody suing? Well, they will sue.
Yeah.
And it's going to cost the government more money because if you remember the last suit that DOC guards had pursued, there were interests paid to that as well.
Right.
I mean, this administration is, not thinking ahead.
Not thinking ahead or not thinking?
Not, well, that too, but, you know, at the onset of this, there should have been three task force. One from the beginning on protecting the health and welfare of our community and keeping, you know, from the spike going up. Okay, that's one. The second task force is how do we keep some essential businesses open in the government of Guam and not lose so much revenue or the economy from completely falling down into rubble. And the third one would be, you know, going back to normal, trying to go back to normal, but not only going back to normal, but utilizing some of the things that we've done during this lockdown. Less paper, uses of paper, finding out that telecommunications are actually very helpful. What has been a plus to all this lockdown, and incorporate that into back to normalcy. Those three things should have been put into place first and foremost, but most especially, of course, transparency. But I don't think this administration wants anybody to help them. They just want to do it on their own, and look what's happening. You know, it doesn't work that way. It takes a village. It takes everybody to be a part of this. Their voices count. The people's voices count. You know, the legislature's voices count. The mayors count. The judicial branch. Everybody's voices count. And if she's going to have her task force made up of yes men and not even incorporate, you know, I heard that she's finally bringing Governor
Uncle Carl.
Yeah, into the mix. What about Governor Cavill? He went through some state of emergency situation. Why not bring him in as well? You know, we need to all come together, and it's unfortunate. We can sit here and complain too as well, left and right, and let's provide some solutions here. Let's make the best of this. And it's unfortunately that, you know, and I'm reaching out to the governor. I even saw her brother yesterday at the grocery store, and you know, he was kind of dogging on me, saying, "Hey, you know." I said, "Hey, I've been reaching out to your sister. She's not, you know, taking my calls, or, you know, I have some things to also let her know. Constituents call me too the same way, and they have some great ideas. She can take it or leave it, but at least hear us, at least hear our voices." And the sarcastic remark that she made, well, that was so disheartening. I was so upset. It took me a couple days, you know, just to keep biting my tongue.
Which one, the wand or you're lucky to be alive, or?
Yes, to be alive.
I thought the wand was more offensive. You guys are talking about, you should be grateful that you're alive, but I thought the wand thing was insulting to our intelligence, because it's a statement. If you look at it, some people think that when you become governor, you can wave a wand and make all the problems disappear. It's just, I mean,
you can tell he's been working.
We're not idiots. We're not idiots out here.
That is comical. To me, that was comical.
I mean, who wrote that? Who said, "Yeah, Governor, say this"? Ooh, yeah, that's good. Ooh, yeah, Governor. Tell them these idiots. We think we got a wand. We don't even have a wand.
Yeah. Well, I think the other one was. For me, you know, I guess everyone takes it differently, but that was comical to me. But the first one was very disheartening.
Right. Yeah.
I think everybody stays alive because of their own actions. Mm-hmm. They're the ones out there protecting everybody else.
Yeah.
You know, they're the ones that decided to stay home, you know, to protect themselves.
Well, you know, you were talking about the onset of this. There was all this money that was there. Then now a whole lot of money that's been spent. Has the legislature, anyone in the legislature at this point, are you aware if anybody has seen any sort of a breakdown on where money has been spent for this COVID response?
Yeah, actually, as far as the COVID response, no. But as far as transfer authority that she had, actually, it was quite amusing because I received through the media, so that's why I listen to you guys every day.
You're welcome.
I get more information from you than I do from the administration. So the first one that came out, the $4 million, do you remember that?
Yes.
The transfer authority,
Mm-hmm.
$4 million.
Mm-hmm.
And yet I didn't see anything official because I received that from the media. I didn't receive that from, you know, our OFB oversight chair at all. And I'm figuring, okay, it came out of legislature, it came out of the judicial branch. That's $4 million. But
Yeah,
didn't really
that
have-
wasn't posted on the legislature's website. You're right. We got that from somebody.
Oh, right.
And then
we have the 7 million. Right, exactly. The 7 million that was pulled out.
Mhm.
Right.
Now, what did she spend it on? Nobody knows. Nobody seems to know except them.
Well, I
It says
think-
mandatory quarantine protocols and a temporary hospital program for the 7 million. That was officially posted on the legislature's website on April
That is
2nd.
so broad.
Yeah.
You know, that could be anything under the sky, and that's probably what the best thing, you know, the answer they can give to us without answering it. That sounds like a Lester Carlson answer or remark. You know, it doesn't.
We had him on the show to talk about that, actually.
Oh my gosh, did he really answer? Which?
Well, he wanted to clarify because when we had first did the story on the 4 million because they were taking money out of the judiciary, I think it was, and the legislature. And so when we had did the story about the April 2nd letter, we had said that we weren't clear if this is on top of the 4 million that they had already that they had planned to take out of the legislature and the judicial branch. So he said, no, we scrapped that because, you know, we're not going to tap into another, you know, government, you know, branch of government.
Yeah. Well, now's the time for the legislature, as we know, we're all going at well, not all of us, but the Committee on Rules is meeting at 4:30. And if the governor is not going to answer a question during public hearing on certain bills, because, you know, the bills that should be up, the first bill should just one bill asking for transparency. That's it. Let us know you have every 2 weeks to provide us what you have spent this money on. I'm sure the OPA would be very, very happy to see that.
He's
Makes
actually
his
on
life
the
a
line.
whole lot easier.
Yeah. We've got him on the other line, Senator. So if you want to wrap, we'll jump over to him.
No, I'll wrap it up then because I'm anxious to hear what he has to say. I've spoken to BJ about a week and a half ago and talking to him about funding and money and on certain agencies on audits. So yes, I'd like to hear what the latest is and how is he going to go about and get that kind of information that we all want to know.
Right. Okay.
Okay, and if I'm hoping too that the administration, please, let's all come to the table, you know, and discuss this together. You know, not one mind is better than having many other minds is much better than one mind.
Well, thanks, Senator.
Wash your hands.
Thank you. Yes, and create a great day, everyone.
All right.
All right.
Okay. I'm trying my best
Stay safe.
after this morning. 8:59. Let's go over to Public Auditor BJ Cruz. Good morning, Public Auditor.
Off a day.
Good morning.
Wow. So what have you been up to?
Reading audits.
Oh boy.
Well,
So
we
what
don't-
about the letter from Speaker Tina Munoz Barnes? Did you get a chance to read that?
Yes.
What did you think?
Well, no, I understand where people want. We all want some accountability, and this Saturday, most of my staff will be tuning into a webinar that the National Association of State Auditors and Controllers and Treasurers will be conducting to give state auditors some idea on how they can and should be or will be auditing CARES Act expenditures and COVID expenditures.
Yeah, Public Auditor, could you just go over what, because there was someone talking to someone yesterday, they said, oh, you know, Public Auditor BJ Cruz, he doesn't have the authority to audit this CARES money, it's federal money. What's he going to do? He doesn't have, can you just clarify what authority you have to conduct audits or whatever that involve the use of federal funds?
We can, the Guam Public Auditor's Office of Public Accountability, by statute, has been given the authority to be able to audit anything that the government of Guam does. I will admit that and I told Speaker this when I spoke to her yesterday, the only authority that the public auditor does not, the Office of Public Accountability does not have, is the 6103 authority to be able to review income tax returns. So that really is going to impinge on our ability to be able to check on who gets
Stimulus checks.
The stimulus checks and who gets the unemployment.
But
You know,
you can track where this $118 million is being spent. Who's staying at the Pacific Star on the government's dime? Those kinds of things you can check into?
Those kinds of the expenditures, as long as it doesn't include or necessitate my looking into income tax returns, I can review. Expenditures for, as you put it, hotels that are being used as quarantine centers. We can look at the standard operating procedure and do a performance report on how that was implemented and what shortcomings there were. When it comes to the $194 million that's going out to unemployed individuals, I'm not sure how we're going to be able to do that. That's why I'm really intrigued with this training this weekend, to try to figure out how we're going to be able to determine who is qualified.
Well, I know Dave De La Sola in previous interviews, he's been saying that, you know, he has to make sure everything is legit, all of the information is accurate, because he could be subject to audit by, I think he said, the Inspector General?
Yeah, the Office of Inspector General and also the General Accounting Office has announced that it's going to be doing audits because of the fact that the Trump administration has sort of indicated that you know, they don't want to have, they've been firing inspectors generals. The GAO is completely separate, and so they're going to be doing audits themselves. I misspoke. It's the Government Accountability Office. GAO has changed the meaning of its acronym.
Speaker, what advice? I mean, do these senators like call you? You got the institutional knowledge. I mean, they're all saying the same thing. I mean, even those Democrats in the leadership positions, the innies, I like to call them. Even now, they're starting to turn on the governor and calling for transparency and saying, "Hey, we don't know what you're spending money on." So if you can't go in there and do the performance audits, or you're limited, the GAO or whoever can only do it, then what advice would you give these senators in terms of, like, how do we hold the administration accountable, and how do we just get basic info during this public health emergency? Maybe you should do like a TED Talk or something.
Eventually,
I mean, geez, these guys
eventually we will all find out. But the thing is that we have to understand that it's financial management that the executive branch has. And, you know, I've been cringing because in some of over the last two or 3 years, how many times have even when I was at the legislature, passing legislation to make sure that there's no commingling of funds. And when you receive funds for a certain purpose, it should be spent for that purpose and that purpose alone. And I'm not sure what the Memorandum of Understanding or MOAs with the federal government are on the various tranches of funds, of whether or not there's no commingling of that those funds are only for that very purpose. It's very clear in the guidance straight up that you can't reimburse yourself for money that was already accounted for in your budget.
Right.
You know, I think that's number 2 in the whole set. So there are some things that they can't, or they shouldn't be doing if it's already budgeted for in the current budget. But we also have to remember we were all in the media were screaming at Department of Administration about commingling. I remember how exorcised I was when I discovered that they approved the use of child support money to make payroll. People forget that. And then when we had the hearing and the controller for the government of Guam came in and said, you guys passed this legislation, you want me to do this, you want me to do this, and you want me to do this. Which law do you want me to violate? Which law do you want me to break in order to be able to do the things that you want me to do? So we just have to have, allow the administration to spend money. I mean, to do what they have to do, but they also have to remember, as Mr. De La Silva told you, they're going to be audited, and if any of the expenditures are not approved, are not approved, then the government of Guam is going to have to pay that back.
Mm-hmm.
So they better be careful, because we're in a world of hurt right now. Mm-hmm. I mean, we thought that the CRER from last month looks bad. The CRER that's going to come out for this month of April is going to show a huge deficit, because April 15th is the date that all the tax refunds tax payments were supposed to be made. That's been moved to July.
Yeah. It sounds like you're saying
they don't have all that. They don't have all that money.
So it kind of sounds like you're saying that we just got to wait till it's all over.
We just got to trust them that they're doing the right thing.
Necessarily mean to be all over, but we need for it to get started. And the one advice that I gave, the only advice that I gave a couple of weeks ago when I was interviewed, was read the regulations, be intimately aware of every single reg that there is, and religiously and scrupulously apply each one. Do not waver, do not, because if you do, then there will be unapproved expenditures, and we'll be responsible for the reimbursement of that. We have no money to reimburse anybody.
I guess in closing, because we just kind of wanted to see where you were on and all this. What would your message be to those people? Because public auditor, people kind of look to you as someone who holds people accountable. Office of Public Accountant.
And that's why this weekend at 5 o'clock in the morning, because the webinar starts at 3 o'clock on Eastern Standard Time. So at 5 or 6 o'clock in the morning, my staff's getting up to listen to this webinar, so that we can learn what it is that all the state auditors and comptrollers and treasurers throughout the country are doing, and what advice they have for us on how we're going to be able to audit these things. I mean, this is all new for everybody. Mm-hmm. This is not something that we've done before, especially in the amounts that are involved. $194 million on unemployment ones. That's going to be really hard. And how do you account for who were the ones that received it? How did they just, did they have the proper certification that these people were released or laid off? There's the issue with the first $1,200 only going to people making less than $75,000. Immediately somebody, I'm sure, is going to say, "How did so and so get a check for the $1,200?" Well, if I'm asked, and I say, well, especially if it's, how did Senator so and so get it? Well, we all know that they make less than $75,000.
Yeah.
So I won't need to go to their income tax returns to be able to determine.
Yeah.
If they're married, however, then I don't know how much their spouse makes. Whether they make over the 150 combined, would that disqualify them? I won't be able to determine that. So there's some that we're going to be able to see, and and I'm sure there's going to be all kinds of finger pointing about how did so and so get it, and so they have to be really careful to make sure that they don't screw up, because it could mean that in August that our Section 30 is reduced by whatever amount they disqualify as expenditures, which puts us in the hurt for the next fiscal year.
Right. So, Public Auditor, I guess just for the people out there listening on all the different platforms, what would your message be to them in terms of them expecting you to hold the administration accountable, to make sure that they're being transparent, to make sure they're not doing any funny business? What would your message be to those people? Because, like I said, I kind of thought you were going to go harder. Bang the table. We're gonna. No.
Unfortunately, I'm not going to be able. I'm not. My staff's not going to be in there reviewing before the checks go out.
Right, yeah.
We're going to, when we audit, it's going to be after the checks go out, and we see what the expenditures were and whether or not they complied with.
Are you going to be looking back at all the procurement, because we've waived all the procurement during this public health emergency? Is that something that your office has the authority to do and will do?
If somebody makes the request, then yes. I mean, like yesterday's Post editorial reminded everybody about the fact that I questioned the last administration on the reimburse, on the retroactive pay. I immediately yesterday afternoon got a text, an email from a citizen saying, "Did everybody pay back?" That's going to be that I will hold as a request by a citizen for an audit of that. I hadn't looked at it, but now that this citizen has
right. So
are you also going to be looking at the issue with who's getting double pay, who's not getting double pay,
who's getting hazard pay, who's not?
Yes. All of those things will be utilized. And when Speaker called me yesterday, and she said, "What do you need?" I said, "Forget. I only have 9 auditors. You budgeted me for 11, but unfortunately, 2 of them got pirated away by agencies that were able to pay them $20,000 or $30,000 more than my office is able to pay." And so I'm down 2, and I don't know. We were in the process of hiring. In fact, I had just gotten the recommendation from the review staff on who to hire and the number of them, and we were ready to put them on, and we went into lockdown. And now we've been notified that our office budget has been cut back. So I'm not sure I'm going to be able to pick up additional people. I told her, I said, I need auditors to be able to do all of these things. It's impossible with just with 9, and the fact that we have to comply with GASB rules and things, and so it's every one of those audits is done by 2 people, not just one. One is the field auditor, and then there's one that reviews it, and then a third reviews the work that the first 2 did, and then somebody cold reads it. It really is labor intensive.
Mm-hmm. Well, like the Vice Speaker said, where there's a will, there's a way.
Right. So is there the will with you, Public Auditor?
No, there's definitely a will, and my staff was really excited when I sent them the text that I got, email that I got yesterday, or the day before yesterday, that there was going to be this webinar, and I said, "Does anybody want to listen in on this?" And most of them were saying that they were willing to get up at 5 o'clock on Saturday morning. to listen to this webinar so that we could learn. I said, well, we're going to be asked to do a number of that's all we're going to be doing for the next year is COVID related
auditing, right?
Audits. So we better learn
right.
how the states are handling it and what we need.
So public auditor, I wanted to go back to the procurement because we had gotten this. I guess it's a bill that they sent to Linda over at Public Health. It's from Pacific Star. It's for a rental period of the Pacific Star Hotel from March 23rd through April 5th for a grand total of $600,000. And so, I mean, that's a pretty short rental period, and they've obviously been using that hotel for a while. So I guess you can reasonably come up with an estimate of 1.6 million or whatever. But then, so they got this service, but then when you look at who owns the hotel and how much they donated to Lou and Josh's campaign, it just kind of reeks of, I mean, it is what it is. I know the way the game goes, but I mean, that's why I'm saying we can talk about the stimulus checks and all that stuff, but with the emergency procurement, we keep hearing there's a lot of stuff going on. So, again, how closely of a look are you going to take at those things?
We will be looking at everything and everything that people... all the whistleblowing that
can I just count that as a request, or do I got to call and leave a message?
Well, no, you've not needed to. You forget how many you've made requests of. That I've taken care of.
Right on. Okay.
So just so we're clear, when a state of emergency, declaration of emergency is declared, all procurement rules and regulations are pretty much out the door, and you just move forward and procure, purchase, hire, whatever you need to get the job done. Is that how it works?
I will withhold whether or not I agree with that until we do the audit.
Okay. Well, thank you, Public Auditor. Appreciate the call. And then I guess maybe we'll touch base with you next week because I feel like people are going to be sending you a bunch of letters because the senators are pretty upset.
Okay.
Okay. You all right, though?
Thanks.
You okay?
Sure.
Okay. Thank you.
All right.
Wash your hands. Okay. Public Auditor BJ Cruz there, 919. Let's take a little break, and we'll come back with more of KUAM News containing COVID right here in Guam's favorite, I-94. Good morning.
Banners, posters. Self-storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
Be healthy. Be informed with ITD. Be healthy. Be informed with IT&E.
Self-storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus, gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Oh, yeah. Hey, good morning, Guam. The KUAM News takeover of Guam's favorite containing COVID. Let's go over to the phones where we have from Public Health's Community Outreach. Echo. Francis Epris. We're going to bring him onto the show just to give us some good info. Good morning, Francis.
Good morning, Chris.
How are you?
Very good to hear from you again. Sabrina is here as well.
Oh, hi, Sabrina. Good morning.
Hi, how are you?
Doing fine, Sabrina. Thank you for asking.
Oh, you're welcome. You sound really
ready,
chipper.
You sound like you had your coffee. We had the Archbishop call this morning. He sounded like he was half asleep. Public auditor was like, the Vice Speaker Nelson sounded tired, but you sound like you're ready to go.
Oh, yes. We have another community drive to walk-in testing for today.
Yes.
Right. Sabrina, yeah.
In Manila, right?
Yes, it will be in Manila from 3 p.m. to 6 p.m. at Manila Center near the Mangilaw Night Market next to Santa Teresita Catholic Church in Mangilaw. And this is open to all residents who are in the central area of Guam. So if you're living in Agana Heights, Asan, Mayna, Barigada, Chalampago, Ordot, Hagana, and then Mongmong, Totomayti, Sinahanya, Tamuning, and Tumon. So you are welcome to go there while supplies last. Individuals with COVID-19 symptoms are the one to be tested.
Were you at Estumbo yesterday?
Oh, yes, I was, Sabrina, yes.
Okay. And so how many people were at Estumbo?
Wow, we have a lot of people there, Sabrina. I might not be right with my figures, but I know it's more than 100, more than 120, something like that. I'm sorry, I might not be able to give you the exact figures, but I know there'll be a JIC information that will be provided on that one.
Right, yeah, because the release said that there were 112. That was the number of results that came in last night. And
And
so
I think
it
that
just,
was only
and
partial.
yeah, okay, it was only partial because, from FBLG, there were like 60 workers and employees, volunteers that were supposed to come down and get tested. And I wasn't
yes,
sure
they
if
were
the
there.
60 were part of the results that came out last night.
Oh, yeah. Even Miss Sabrina, I have no idea.
Nice
if
try.
it's part of the 112.
Nice try.
Okay, so how many people are you expecting today?
Wow.
Because that's a
Sabrina,
lot.
Yeah, with the coverage that we're thinking in the central area of Guam, I'm not so sure, but hopefully we still get a good number. Hopefully there'll be 100 or 100 more, things like that. But we will see. And I know public health is getting ready and being prepared. Like us always, for the past few days, we are here to provide this COVID-19 drive-through walk-in testing for everyone in the central area of Guam.
Yeah. And so how many samples? You guys probably bringing, 200 and then backup and then another backup?
I'm not sure with that number, Sabrina. It could be, but then again, yes, we're expecting with that number, hopefully, yes, we'll be able to provide whatever is needed to anyone who'll be coming there.
And Francis, so people who are coming to get, tested, can we just go over the criteria that they need to meet in order to get the free community testing today at Mangilaw?
Okay, Chris, the criteria that we're going to look for if you would like to be tested for COVID-19 are those individuals with COVID-19 symptoms and multi-generational families in a household, like if they live with parents, grandparents, great-grandparents, adult and children, and their children with COVID-19 symptoms. So they are most likely to be tested for COVID-19. And this will be free and open to those residents in the central area of Guam.
And what about those who with pre-existing conditions? Because Linda had told us that people with diabetes, cancer, lung and pulmonary disease, other pre-existing comorbidities.
With those pre-existing conditions, if they are being to be tested, I think so far from my listing right now that I'm checking, we are only attending to those symptoms, but with pre-existing conditions, we only have, so far from what I have right now, are the symptoms who have COVID-19 symptoms are the ones to be tested.
Yeah, but public health, they're going to be going out there to people that can't make it to
Right. Homebound.
Mangilaw.
Is that accurate, Francis? You guys doing the homebound testing for those people who are homebound?
Good question. So if ever, what I know, Chris, right now is that if ever they went there and they are not able to meet that criteria, so nurses will be there to assess them. If ever they will not be able to meet the criteria, what would happen now is that we get their name and phone number, and we will be calling them back.
Can you tell us about...
No, go ahead. No, go ahead. Go ahead.
Ladies first.
No, because I'm going to move on to another...
Oh, okay. When people get tested, right? So let's say I go there, you guys do the swab. When do I get contacted about my results?
Oh, the results, Chris, would be, as far as I know, it would be around 24 hours or in a day, but nonetheless, they would be called upon, okay, if ever, whatever the results of their test is. So a nurse or from public health would be calling them whatever the results are. So with the duration of how long will they receive their call, I'm not so sure on that part, Chris, but definitely someone from public health would provide them an information of the result from the test that they had on that day.
Would they release, would they call them first before the numbers are released by the Joint Information Center at the end of the night? For example, if I wasn't contacted, that means that it wasn't counted in the count that was released by the JIC.
Oh, good question, Sabrina. So far, what I know is that regardless if it's positive or negative, they would be provided an information of their result. But for how long, Sabrina? At this point, I'm just so sorry. I could not provide on how long will it take for them to know their results. Yeah.
Okay.
But for sure, public health will be calling them back for them to know whatever the results are.
So
and if they have questions on it, Sabrina, they could always call our community health centers if they have some further more questions, or the triage hotline.
All right. So you guys are all ready to go for today.
You got your PPEs, Francis?
Oh yes, Chris. If you only know how am I wearing my PPEs? Yes, I'm just so excited.
How are you wearing it?
Today.
How are you wearing it? Are you wearing it inside out? Or are you wearing it?
Oh, there's a proper way of wearing it. As long as you properly observe there's a clean part area, and then there's a dirty part. So, meaning though they're clean, Chris. Okay, don't get me wrong.
I know.
But what I'm trying to say is that as much as possible, we do it in such a way that to prevent any contamination, things like that. But yes, we'll be wearing our PPEs. Nurses will be there to be wearing their PPEs and proper outfits.
You sound like you have like a really fashionable mask.
What kind of mask you got, Francis?
Yeah.
Oh, I usually wear a N95 mask, but right now I'm wearing the surgical mask that we usually wear when you are out, things like that.
But are you wearing like one that's like pimped out? Does it got like
the flowers
or because Bree likes to wear a special mask sometimes on special days.
Oh, I'm not yet used to it for wearing some colored mask or whatsoever, but I'm just so simply wearing the surgical mask.
Oh,
yeah, I know it's becoming a fashion trend. And
I know, yeah.
Nice designs. And I like the one that you were wearing the other day, Chris. I saw that on TV.
Thank you.
The green colored one? Yeah.
Oh, wow. Yeah. Thank you.
All right.
Francis, what other information you have for the public out here? So we covered the community testing. We got all the info on that. Is there anything else that you want to add here so we can make it worth it?
Yes, Chris. By Friday on May 1st, from 1 to 4 p.m., the COVID-19 Community Drive to Walk-in Testing will be held at Agat Senior Center near the Department of Youth Affairs. And it will be free and open to all of our southern residents of Agad, Inarahan, Meriso, Piti, Santa Rita, Talafopo, Umarak, and Jonia. Okay.
Are you going to be part of the group that's going to be heading out on Saturday to the congregate homes, to Hemlani's?
Oh yes, we'll still be a part of that, and we look forward of having that conducted in those areas that you mentioned, Sabrina.
Is there anything that these people should know?
Well, first and foremost, they should have, other than knowing where to go to, they should bring their ID for identification as well. Please do not forget the ID for them to bring with them once they be interviewed for identification purposes. And during also, before I forget, Sabrina, Chris, in our COVID-19 testing, we also provide them our pamphlet or booklet, which provide information, a Guam guide to COVID-19, so that they would be continuously provided with information if ever they have the symptoms or whatsoever. So it's a nice booklet, a Guam guide, that provides information on what is COVID-19, definition of isolation and quarantine, and other stuff that they could do with their kids, resources that they could do with their family as well.
Is that online, this booklet?
Oh, yes.
Okay, maybe we could get a copy of that and we could share it or something.
Yeah, Francis, how do we... You want me to WhatsApp you, or you want to send us an email? You seem like an email kind of guy.
Email, yeah. I'll just send it to you by email, Chris. Yeah.
Okay. So it's just Chris at KUAM.com. CHRIS.
Okay.
Or Sabrina.
Chris. So let me write that down, Chris. Sorry, I don't have my pen right now. So
it's okay. I'll text you. Don't worry about it.
You text me? Okay.
Yeah,
Great.
All right. So thank you for calling in, Francis. Really appreciate your time. Was there anything else you wanted to get out?
Well, as like what we always said, observe social distancing, okay, and always wash your hands no less than 20 seconds. And please stay still at your home. If you don't need to get out, please don't. And if you're going out, don't forget to wear a mask.
All right. Thank you so much.
Thank you, Francis.
Thank you, Chris. Thank you, Sabrina. And thank you for having the ECHO team, Department of Public Health Social Services, in your radio show.
You got it. You bring a lot of sunshine. You call
Thank
anytime,
you.
Francis.
Thank you, Chris.
Call in next week.
Yeah, I'll text you. Also, Rachel. Maybe we get you and Rachel on the line at the same time. That would just be all kinds of awesome.
All right. Thanks, Chris.
Thank you.
Take care.
Okay, bye. Francis from Public Health's ECHO team. Hey, let's keep it going now and go from the ECHO team to the CNMI, where Tomas Maglotnia is standing by.
Hi, Tomas.
Good morning, Tomas.
Good morning, Chris and Bree. How are you doing?
We're doing pretty good. We do have some questions for you, but let's go ahead and take care of business now with the latest from the COVID-19 response in the Northern Marianas Islands. He is our correspondent in the CNMI, Tomas Maglotnia. Good morning, Tomas.
Good morning. Here's the latest on containing COVID-19 in the Northern Marianas. The CNMI's 4-day fiscal response summit came to a close yesterday. Representatives from all three branches of government convened to face the challenges of the CNMI's fiscal crisis impacted by the coronavirus. Here's a part of the NMI Governor Ralph Torres' closing remarks for the community.
But at the end of the day, what is the most critical part is how do we move forward? And having Team A and both teams address the same issues, and how do we get to where we need to be, and the actions that we... But at the end of the day, what is the most critical part is how do we move forward? And having Team A and both teams address the same issues, and how do we get to where we need to be, and the actions that we need to move forward in making those decisions. A lot of these decisions, again, we acknowledge that it's not easy, but a decision that needs to be made. So where do we go from here? What I like to ask is, there's a lot of legislation that needs to be done. I want to continue to work with our Speaker in the House, as well as Senate President in the Senate, as well as our judicial branch. We have a lot of things that we need to move forward and address, whether it's tax structure, annual leave, rebate, or the community chest funds. What I want to propose is May 14 to ask our team to reserve this day and do a follow-up on action that needs to be made. I do know that in the executive branch, we have a lot of work that needs to be.
Last night, Governor's office tells KUAM that 71 people were tested on Monday, with first responders and some medical workers. An additional 153 residents were tested yesterday. That brings it to a total of 224 tests so far for both Monday and Tuesday's process on Saipan. And again, as a reminder to the community, step one, if you're requesting a test on Saipan, is to register online or over the phone. The NMI Governor's Office tells KUAM that the drive-through testing appointments are scheduled from Monday to Sunday, 7:30 a.m. to 8 p.m. They're preparing to roll out plans for community-based testing on Rota and Tinian. Also, the NMI Congressman Kilili Sablan and Delegate Michael San Nicolas just held a joint conversation with Representative Raul Grijalva, talking about relief for the territories and why the federal government must not abandon them. Also, in developing news, flights are planned to resume between Guam and the NMI in the next month, and mandatory quarantine is still in place. And so some community members are asking, how much is the government paying for the hotels, and who exactly is paying for it? The NMI Governor's Office telling KUAM that the task force is making adjustments because, as you know, they're currently using the terminals for community-based testing. So, Chris and Bree, that's the latest here in the CNMI.
I think you missed something. I'm just kidding.
Ooh, wow, Bree got jokes. I was like, oh, what did you miss?
So you listened in on the discussions that were happening. Were the media allowed to ask any questions, or it was just here we are and listen to us and what we have to say type of thing?
Yeah, so the federal coronavirus response roundtable was held, chaired by Grihava, Vice Chair Gugaro Sablan, and then Representative Michael St. Nicholas. It was about an hour and 30 minutes long. It just finished a few seconds ago, actually. And so we had, for the region, the CEO of the Commonwealth Healthcare Corporation, Esther Muña, talking about the efforts that have been rolled out. She provided some new numbers that I thought were really great to mention about the response in the NMI. She said that so far the NMI has screened more than 500 walk-in patients for COVID-19 symptoms, screened 1,500 passengers at the airport, and traced 250 contacts of positive cases. So these are new figures that were revealed at this virtual town hall hosted by the Natural Resources Committee. Dr. Tom Shea, representing his clinic, talking about the response here in Guam, echoing his concerns and his plea for the Navy to help with Guam's public testing capability. He reiterates again that there is a lack of medical staff on the island and that the key is to reopen. Delegate Michael St. Nicholas, in his remarks, really driving home the point of the need for oversight on the federal funds that are being allocated to the territories. He called out the governor specifically asking for more transparency from the Magahaga on Guam, and all the other territories also sharing that overwhelming call for transparency as federal funds continue to pour into the local government. That was the main theme that I noticed in the hour and 30. All the territorial governments and health professionals asking for that transparency with the funds.
Interesting. How bad was the call out? You know, Mike St. Nicholas call out 1 to 10.
It was interesting. On a scale of 1 to 10.
Right.
I mean, is anything really below a 10 with this type of call out? But I think that the frustration was shared in terms of money pouring in, but and especially with the medical professionals, all of them, we also had for the U.S. Virgin Islands, the Department of Health for American Samoa, we had a Medicaid representative, and then some advocates from Puerto Rico, all of them saying that medical professionals continue to not have the armor they need for this fight. And so I thought that was a resounding call from the medical professionals on this, and the politicians, holding this virtual roundtable to get the answers they want from people on the ground.
Okay. So what about Dr. Shea? Did he get to talk?
Yes, he spoke for a fair amount with answering questions from Delegate St. Nicholas. Again, he made that call thinking that because the Navy was able to test, all of their sailors, then there ought to be that shift in response to helping the public community. He also reiterated the need for transparency and, really pushed for all federal relief to be directed for the people of Guam. And again, he said this on the show several times. The key is to reopen because we can't, as he says, base numbers on larger populations that are not equal to Guam.
I wanted to follow up on something with the governor. He had requested United Airlines to temporarily suspend flights, and that went into effect, I think, on the 5th or something like that. And it was supposed to end, I thought, on the 30th.
Yes, that's tomorrow.
Right. Have you heard? It's tomorrow? Is today the 30th? Oh, tomorrow. What do you mean?
The 30th is today. Oh, that's today. You're right.
Yeah.
Sorry.
It's that kind of month, Tomas.
Have you heard anything else from the governor on whether they're going to be resuming flights?
Yeah, and so local media reporting that the Guam and NMI flights are going to resume 3 times a week. I believe the report said around May 2nd, and then I reached out to the NMI press secretary asking, obviously, how does this affect the drive-through testing? Because it's currently being done through the airport. And so Kevin Bautista telling me that they're looking at adjustments, possibly moving it to another terminal. And the quarantine still is in effect, and so that's why people are raising some questions about how exactly is this being paid if we start to open these flights, at least between Guam and the NMI. Then what does that look like in terms of having to quarantine every single passenger that has, will come? So we're going to get more on that. We're awaiting a response from the Commonwealth Ports Authority to also ask about the flights originating from Asia and when they might have plans to return. We're hearing July now, but there's no official word on that just yet.
Tomas had a comment here. I mean, he kind of already answered it, but let's just get it out here. Ryan, can you ask Tomas how can one traveling from Guam to Saipan get cleared in Saipan if they've been cleared for COVID in Guam from public health?
That's a good question. I'll get the answer to that. I don't have an official response right now. The official word is that if your final destination is the NMI, you're going to be quarantined. I haven't heard, I personally have not heard of any exceptions to that, but I will follow up on that for sure.
Yeah, you see how well that works. Hey, I got my Guam clearance right now. You get your dogging into quarantine, boy. But
because I know different jurisdictions have, I mean, I also have plans to possibly go to Guam in the summer, and I'm wondering if I get my test here, will that apply? Will that be an exception in Guam?
No, we're going to get you on the Tony Babauta quarantine stay. You just go one night, the next morning they check you out, and then you out the door.
Wow. Okay, that sounds great, I guess.
Perks,
but
Tomas,
yeah,
perks.
a lot of people turning their attention now. Everyone across is talking about reopening and what that looks like.
Yeah.
And yesterday they tested 153 people through the drive-through testing here. So we're going to continue to monitor those numbers. We know results can take up to 5 days, and so we'll probably have a better picture really next week on what community-based testing means for us.
All right. Thanks, Tomas.
Appreciate it.
Thank you so much.
Okay.
Talk to you later.
Wash your hands. Tomas Maglotnia out in the CNMI. Hey, we're going to take a real quick break, and what a show it has been. But with all the stuff that's going on, all the negativity, all the scandals, all the hotel stays, we're going to end this show on a positive note. If it kills me, we're going to end it on a positive note, okay? So we take a little break and come back with a good note here on Containing COVID. It's a KUAM News takeover of Guam's favorite Good Morning.
KUAM.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
Be healthy. Be informed with ITD. KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc. Be healthy. Be informed with ITD.
this war against COVID-19, it's going to take all of us to do our part.
We are all frontliners in this epic battle.
And on Tuesday, May 5th, we're asking you to answer the call to help by taking part in Giving Tuesday Now.
It's part of a global initiative to set aside this one day for the pandemic crisis.
To step up and give a donation to any of our island's nonprofit organizations.
The hospital, the Mayor's Council of Guam, or any of our frontline workers. Whether it's PPEs, gloves, masks, canned goods, no donation is too small. Anything and everything will help.
And if you make your donation, take a picture, post it on social media, and use the hashtag GivingTuesdayNow and GivingTuesdayGuam.
And then later that night, make sure to tune in for our half-hour special Giving Tuesday Guam, Together We Give. We'll showcase how everyone is taking part.
Be healthy. Be informed with ITD. Healthy. Be informed with ITD. KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
Me a rebel. I'm not really scared. There's no sense denying the system has already failed. What I don't understand, you could keep a straight face and tell us it's okay. There's a brighter day. But when you need the
Savage K 956. Time now for our good notes.
Yay!
And after this morning, you might need two good notes. But these guys are doing some great things here. There's so many people who are doing what they can, and what I love to see is, I call them like the little things that people forget about because we're just so consumed with trying to stay alive and trying to eat and trying to put food on the table, trying to find the money that you need just to make it through every day. But one of the things that people are struggling with is food for their pets. I didn't even think about this.
This is real.
I mean, it's a real need. People out of work, furloughed, layoffs, whatever the case may be. There's a need for this, and that's why I wanted to bring Lonnie from Guahan Paws for Pets onto the show and just kind of share the great things that you guys are doing. Good morning, Lonnie.
Hi, good morning, Chris. Good morning, Sabrina.
Good morning. So tell us about what you're doing.
And tell us who's with you there, because I know it's not
two other ladies on the line. We have Tina Guzman. She's actually the founder of Guahan Paws for Pets, and then we have our other lady that's involved with us, Asia Fernandez.
Okay, so let's just start at the beginning, ladies. How did you guys come up with this idea, and how did you identify that there was a need for people to get assistance to be able to feed their pets?
So it's pretty much, so Tina originally founded this group a little over a year ago. It was mainly to find missing pets, missing dogs, but then it kind of grew into rescuing animals, strays, getting them fostered out, and then eventually getting them adopted out to, loving families. And that's kind of how I met Tina, with my just passion for, rescuing animals and whatnot. So, and then it just kind of grew. So we have our own Facebook page, Guahan Paws for Pets. And ever since this lockdown, we have a lot of fosters who do foster all these animals that we rescue. And unfortunately, they pay out of pocket for all their supplies, vet care, dog food. So I just kind of got with the ladies and said, we need to create like a donation page, kind of raise some money so that we could, help pay, cover, the costs for their vet care, and also help them with dog food, because, they're really helping us out by fostering these animals, because with game closed, there's not a lot of options for these animals that, need care.
Sorry, I was just looking at all the pictures you sent over. Warm my heart, man. As families struggle to put food on the table for the humans in the house, I'm just so glad that you guys are able to recognize this need and help fill this gap. What has the response been from the people that you help?
So a lot of people have been donating money towards dog food, and then also to help, for vet care, vet costs. Just one of the things that just happened a few days ago, if Tina wants to kind of add in, there was a dog that was hit on, I believe it was Sunday or Monday, Tina?
It was on a Sunday, and this dog was hit here in Dadado. Basically, she was just left on the street to die, and I got a call from another member. Says, "Hey Tina, there's a dog. She was hit and just left there to die." So we got into action. We went and picked her up, and Willa Hill is our member. She drove her to Wise Owl, and we were able to, through generous donations, get her leg fixed. And sadly, from the brunt of the accident, she lost her tail and had it amputated. But she's recovering and doing really well right now.
That's good. Yeah. I love recovery stories.
Thank you.
But then also we wanted to just add that the dog food that was donated was also to. So a lot of us in our group, we go around and we try to feed, the stray dogs around the island. And with this whole lockdown, a lot of them don't really get to eat, because many times the businesses are the ones that are feeding them, like they're, dogs that are just kind of hanging out. So with all these businesses closed, a lot of these strays aren't able to eat. So, a lot of us are going out on our, time off and feeding them, and we're going through a lot of dog food. So that's why I kind of also, was in need of donations for dog food as well.
Okay, and so
these these Boonie babies fed.
And so they just go to the GoFundMe, and you're just asking for monetary donations, or is there a location?
Yeah, monetary donations, or if they want to go ahead and just buy actual dog food, and then they can message one of us, and we can meet to pick it up. That would be great. I did actually meet another member who offered to donate dog food just the other day. And others were donating just monetary, and we went out and bought bags of dog food.
Wow.
So it's not only just the fosters that are taking care of our rescue animals. It's also the strays out there that are they're not getting fed normally because of the whole lockdown. So we try to go out and just make sure they're getting at least like one meal a day. And there was a picture that I did send in. I think it was one of the last pictures. We named him Scooby. I've been kind of feeding him a couple days a week, and there's another lady that feeds him. So we kind of just leave food for him, and I'm sure he appreciates it. So.
Well, we just wanted to bring you on it. This is really cool that you guys thought of this need and are filling it. So people who are listening, maybe Fido's not eating so well lately. How do they get a hold of you guys to maybe avail themselves of some of the assistance that you offer?
So they can find us on Facebook. Our group page is Guahan Paws for Pets. So they'll have to request to be added to the group, and then once they'll have to answer a couple questions, and then once they're added, they can get a hold of us. Our page is full of a lot of fosters that need homes, or people that just need help, finding like a stray dog or kitten or puppy, and just they don't know what to do with them. So we offer a lot of advice and education.
That's good. Yeah, so we're going to share the Facebook page onto our feed here, and thank you, ladies, so much for what you do.
Thank you.
This is a great cause for Guahan Paws, and we just want to tell you guys are COVID heroes.
Having us.
Thank you.
All right, take care.
Thank you, Sabrina. Take care.
Wash your paws, okay?
We sure will.
Okay. I'm that guy.
You are that guy.
I am, all day, every day.
That's my guy.
Hey, you got it. Hey, you guys got it. Thank you so much for watching. KUAM TV 11, the stream at KUAM.com, the KUAM News app, the Docomo Channel 10 stream. And of course, last but not least, our Facebook Live audience. You guys are great.
Yeah.
Keep your questions, your comments coming. I see them. I see you guys are asking about the stimulus checks. You're asking about the unemployment. Man, I had a friend of mine call me last night. He called me like 10 times. I was in the shower. I finally picked up, and he was like, "Hey, man, I haven't watched you guys in the news in a few days, but what's the status with the unemployment?" And there's been no change. And he was just deflated. So I was like, man, I don't know what to tell you. There's no change with the stimulus. There's no change with the unemployment. Okay? Well, there goes our good note.
I know. Okay, I have something good.
Thank you.
So next week, Tuesday, it's Giving Tuesday. So it's one day that's set aside. It's usually, Giving Tuesday is usually in September or November. But next week, Tuesday, we're asking everybody to participate. It is a global day of giving. Just yesterday, we teamed up with 7 Day Supermarket.
And the Jeju Foundation out of Korea. This was a really cool thing.
Yeah.
How much can we talk about it?
Let's just give a little bit, and then because we got to get out of this.
Yeah.
So you were there.
I was
there representing KUAM.
I went out with Betty and Sean from the KUAM Care Force, and we were able to facilitate some very, very generous donations from Mrs. Hong at 7 Day and her partners, the Jeju International Corporation, and we donated hundreds of cases of bottled water to Salvation Army, to the public health community testing sites, also to Catholic Social Services. Yeah. And so it was really cool to just, and we're going to do a whole thing on it, and you guys can see.
But if you're doing a donation, it doesn't have to be this big, this grand.
Right.
Whatever you're doing to help people in the community through COVID-19, send us a picture, post it up on social media, use the hashtag that's on your screen. I think it's Giving Tuesday now. And next week, Tuesday, we're going to be airing a special on television just showing how Guam gives. So make sure to stay tuned for that. But more importantly, give back to the community.
Yeah, all right. And you guys go get tested. Today it's 10:06. That's it. We're out of time for Sabrina. My name is Chris, and it's been, as always, great to talk with you guys for these last few hours. Okay?
Okay.
See you. Guasi Chris, esta. Enjoy!
In order to win this war against COVID-19, it's going to take all of us to do our part.
We are all frontliners in this epic battle.
And on Tuesday, May 5th, we're asking you to answer the call to help by taking part in Giving Tuesday Now.
It's part of a global initiative to set aside this one day for the pandemic crisis.
To step up and give a donation to any of our island's nonprofit organizations.
The hospital, the Mayor's Council of Guam, or any of our frontline workers. Whether it's PPEs, gloves, masks, canned goods, no donation is too small. Anything and everything will help.
And if you make your donation, take a picture, post it on social media, and use the hashtag GivingTuesdayNow and GivingTuesdayGuam.
And then later that night, make sure to tune in for our half-hour special Giving Tuesday Guam, Together We Give. We'll showcase how everyone is taking part.